I'd like to call the September 9th Fiscal Committee to order. And before I start, many of you in the audience today had a wonderful trip to the top of Mount Washington. And I understand that some of you have never been there before. So I'm glad that you had the opportunity to see one of our greatest icons in the state. And I definitely want to thank Executive Counselor Kenny for setting that up for you. And so anyhow, I just thought that was an interesting day for everyone. So first on the agenda are acceptance of the minutes for July 22nd and, oh, I guess we need to do July 22nd. So, okay, we have a motion from Senator Rosenwald, second from Senator Daniels. Are there any questions, comments? Yes?
Chairwoman, I'll be abstaining from this vote since I was not present.
Okay, no problem. All right, will the clerk, do we need to call the roll? Yeah, let's just do a show of hands, all right? All in favor? Opposed? Okay, I have two abstentions. One from Representative Erf and one. Oh, you weren't here either?
I wasn't there.
Oh, okay. We have three abstentions. And Senator Perkins Coawa. Is that how it's pronounced?
Quokka, Perkins Quokka.
Quokka. Okay. Oh, the KW is the Q as in, okay, like in Kuwait. Okay, I can get that. All right. The second set of minutes that we have to approve is the August 10th Fiscal Committee meeting. And could I have a motion, Senator Gray? Thank you. Do I have a second?
Second.
Second by Senator Daniels. All those in favor, please raise your hand. Opposed? Appears I have two abstentions. Oh, okay. Sorry. Yes. Thank you very much. Appreciate that. Okay. Old business. To the best of my knowledge, there is no one that wants to bring FIS 22-023 off the table. Is that correct? All right. We now move to the consent calendar. The following items are removed from the consent calendar. FIS 275, FIS 277, FIS 278, FIS 291, FIS 315, FIS 317, FIS 300, FIS 302, FIS 304, FIS 305, FIS 313, and FIS 316. Are there any other items to come off the consent calendar? Yes?
This is probably an issue with my notes, but my notes suggested 312. We might want to pull that off the consent, but I'll defer to your notes because I'd have to go back and look at 312 right now to tell you if I meant it.
No, I had that as okay, but if you'd like to take it off, we certainly can.
If you don't mind just taking it off and we can just deal with it rapidly if it's not an issue. I'm just not ready to speak to it in the moment.
Okay. 312.
Yes, sir.
Uh,
7.
7. Okay. Could I have a motion to accept all of the other items on the consent calendar? Senator Bradley moves, second by Senator Gray. Will the clerk please call the roll?
Representative Edwards.
Yes.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Coca.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
Vote being 10-0, those items on the consent calendar have passed. I would like to compliment Natural and Cultural Resources for the tremendous job that they did with FIS 22322, dealing with the parks. And that is an example for everyone to look at and hopefully imitate. So I definitely want to thank the people at Natural and Cultural Resources. Okay. We now turn to FIS 275 in tab 3. Tab 4. I can't read. Tab 4. Is there someone here? Okay. No, I don't want to table it. Okay. We will come back to that when Commissioner Jasper or someone. Oh, okay. Okay. Just turn on the mic if you would.
Commissioner Jasper apologizes for not being here. I'm representing the Department of Agriculture.
And do you have a name?
Sorry, yes, Josh Marshall, Director of the Division of Agricultural Development.
Okay, thank you very much. Are there questions from the committee? I do have one question, and that is that your proposal is to fill an unfunded position. Yeah.
I was told that the position is fully funded.
Pardon?
I was told that the position is funded.
Well, it's looking to be funded through this FIS that's here.
I believe that the position was a full-time position when it came to the Department of Agriculture, and that this is the FSMA position, correct?
Okay. All right. Are there any further questions? Seeing none, will the clerk please call the roll? Oh, I need a motion. Okay. Senator Bradley moves, Senator Rosenwald seconds.
FIS 275. Representative Edwards.
Yes to 275.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Coca.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
Vote being 10-0, FIS 22-275 passes. We now turn to FIS 277, which is Department of Health and Human Services for money for birthing centers.
Good morning. Nathan White with the Department of Health and Human Services.
Good morning. Are there questions? Yes, Representative Edwards.
Thank you, Madam Chair. So on 277, I have just a specific question out of curiosity and just a general observation. One, the thing that comes closest to a question is this is funding to help with hospital birthing services, a valuable, important thing. But to the more general point is this write-up has a description of the services. It's a qualitative description of what we're doing, but there's nothing quantifiable in here. I don't, reading this, I don't have a sense of what this $2.4 million will deliver, and what the value add is, and just the things that we need to do our due diligence for the taxpayers to know that we're investing our money as opposed to just rubber stamping a narrative.
Sure. I can certainly speak to that. So, and I'm going to speak to 277 and 278 at the same time, and because they're very similar. So House Bill 1661 appropriated funding in 22277. You'll see 2.4 million for rate increases for birthing services, and then the personal care attendant, roughly 700,000, was also appropriated in general funds through HB 1661. And so we were appropriated those funds through that bill. And then you'll see reference in here. We had a question come through about why are we referencing general funds, and why did we submit a memo to the Department of Administrative Services? So we submitted a memo to accept those funds into our budget. And what you see here is you see the federal matching funds, the 50-50 federal matching funds to effectuate the directive of the legislature through HB 6061. So what you're seeing here, this is the mechanics of us accepting the matching federal dollars.
Follow-up?
All right, I'm going to move on because I had no intent to oppose this, but I'm not sure that you've heard what I've said, so maybe I've said it poorly. You can describe something qualitatively and you can describe something quantitatively. And it's the quantitative that helps me get my head around exactly what the program scope, value, benefits are, and that's not in this document. And since you brought up 278, it's the same observation. I'm good for a good story. I just want enough math to know what we're doing. And what the benefit is. That's all. And I'm not going to hold this up. I just want to emphasize that so that in future write-ups we see a quantitative description of the benefit for the money that we're going to invest. That's all. Thank you, Madam Chair.
Okay.
Okay. So I was going to move to pass, but I'm going to
Okay.
let
Senator Rosenwald?
Thank you. I have a question. Sometimes in the legislation, we include a sentence that says the department may accept federal matching funds without having to go to fiscal. Did we not do that in this piece of legislation, and that's why we have to accept the federal funds?
Yes, that is correct, Senator Rosenwald. That language was not included in HB 1661, which is why we're here today.
Okay, got it. Thank you.
Are there further questions? Oh, Senator Bradley.
Thank you very much, Madam Chair. I would just note for the record that that was my bill that was put onto House Bill 1661. It was a request of the department, written by the department, so just want to make sure the record is clear as to where the snafu came from.
I was not in my role at the time, but I will take the fall for that.
Okay.
Move to approve.
All right. Okay, a motion from Senator Gray to approve, seconded by Senator Bradley. Will the clerk please call the roll?
FIS 277, Representative Edwards.
yes to 277.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes,
Madam Chair, the vote is 10-0.
thank you. The vote being 10-0, FIS 22-277 passes. We now turn to FIS 22-278. Yes, we did.
I would move to approve. I think we just discussed it.
Okay,
I have a question, Madam Chair.
okay. Representative Leishman.
Thanks, Madam Chair. In some of the material you provided the committee just before the meeting, I guess yesterday, there was a chart, and I don't know if this is probably a good place to bring it up or not, but in Table 8 of the information you provided, it talked about clients served by community mental health centers. And I was just curious, in 2012, and this is just on Table 8, it shows a remarkable decline between 2012 and 2020. Could you tell me why there's been a decline?
Sure. I'm going to have Katya Fox, our Director for Division of Behavioral Health, come up.
This is on,
But it's a-
Representative Leishman, are you sure you're on 278?
Yeah, it was in a package of responses, 278. There were a number of charts he provided to us yesterday, I believe, in response to Representative Earth's questions.
Okay,
So, good morning, Madam Chair. For clarification, this is part of the dashboard. So it's part when he references tab 8. It's the dashboard, the operating statistics. But I'd be happy to respond to that question now.
okay. Yep, Representative Leishman, this one is dealing with something.
Yeah, it was just in that whole package that we
yeah.
got, so I figured it's a good chance probably to ask the question.
Okay, well, can we hold off
Oh,
on that?
sure.
All right,
Yeah.
because I saw that as well. Okay, Representative Edwards has moved
To approve.
to approve FIS 278, seconded by Senator Gray. The clerk, please call the roll.
Okay, FIS 278. Representative Edwards.
Yes to 278.
Henrik votes yes. Representative Earth.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes,
Madam Chair, the vote is 10-0.
the vote being 10-0, FIS 278 passes. Okay, the next one that we're taking off is FIS. This is in tab 5. Still, FIS 291. Okay, this one we loved about the IV service that you're providing. I think it was supposed to read Title 4, but that's okay. We did have a good laugh about that, so we're really looking forward to that. So, are there questions that Representative Earth? I'm sorry.
That's all right.
Edwards.
I still know who I am. So Madam Chair, thank you. In my comments to 291, this is basically a 3-pack of requests that we received where it's for this one's for additional workload and pay for marital masters, and there's no way I would want to oppose that. We need to do that, but I'm just missing the numeric story behind this to understand, you know, the richness, the vibrancy, the status of this program. These are just sterile, stale words, and I want numbers. So I am prepared to move to approve, and with just the request that in the future we tell the other side of the story, quantitative as well as qualitative. Thank you.
Okay. Do I have a second? Or are there any other questions? Second by Senator Bradley. Will the clerk please call the roll? Okay, no problem.
FIS 291.
Yes.
Okay. FIS 291, Representative Edwards.
Yes to 291.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote being 10-0, FIS 291 passes. We now turn to FIS 22317 from the Governor's Office of Emergency Relief and Recovery.
Good morning.
Good morning.
Taylor Caswell, Executive Director at Gopher. Chase Hageman, Deputy Director at Gopher.
Great. I'm glad to have you here. Are there questions that folks have? Representative Erf.
Thank you, Madam Chair. I wonder if you could provide an overview of where, should I speak louder?
No, I got you. I got you.
Where this program stands. It's been going on for, well, basically since through the pandemic. And more specifically, once you get through that, what happens when all these, and there's this one, there's several others, I believe, in this same today, and I'll just address them all here. What happens when all these rental assistance programs end at some point in the future?
Yeah. So this program emanates going back, as you pointed out, to I believe to December of 2021 was the first round of we call the Emergency Rental Assistance Program. It's been operational in New Hampshire from roughly a couple months after that, and then a second tranche of funds that came later in 2021. I don't know if I have my March 2020. Anyway, so at this point, we have spent probably a little over $200 million of those funds from the federal government under this program through the New Hampshire Housing. They are the administrator of this program. I don't have the exact numbers in terms of the number of families that have been assisted, but it is a substantial amount over the course of the program. What you're looking at here in this item is 22317 relates to the first tranche of the funds that we received, that the state of New Hampshire received under that program, which we refer to as ERA 1. Those funds are due to expire at the end of September. And so what we're asking for here is to take the remaining amount that we have allocated to ERA 1 and get those over to New Hampshire Housing so that they can spend down those dollars prior to the end of the month.
Right, I understood that. Thank you. But there's another one in here, I think another $10 million or $20 million, if not mistaken. I just maybe capture them all here at one time. But more particularly, my real question is related to all of these, is what happens when these programs end?
So at this point, it's hard for us to have any sort of idea exactly when this is going to end, because we do have an expectation that at some point, we're told over the next few weeks, there will be another tranche of funding under the ERA 2 program, which is a later item, that will keep the program running. So we're hopeful that we're going to be able to drag this to the point where we are able to plan for some level of transition for people that are in the program now. But at this point, it's hard for us to say exactly when that is going to be.
May I follow up?
Please.
I wasn't asking for the end point. I get that. You don't know when it is. I hope it's not never. I'm just wondering, have you started thinking about the fact that it might end, and these people who've been used to this over what has been 2, maybe 3, maybe 4 years, maybe more, I don't know. But if you get some thought to what's going to happen to these folks when, if it does end.
Well, it is going to end at some point. That is a fact. I think what we're working with now with New Hampshire Housing and with the CAP agencies is a series of other programs that go with this rental and utility assistance that go to things like transitional services, support services, and funding to assist people to be able to get themselves into a more permanent housing solution. This program was in its initial design really designed to be able to help people get through a lack of a job or the downturn, the economic downturn, and not able to pay their rent or their utility costs. And so we've seen great success in that program. But as it does end, we're going to have to lean pretty heavily on the services that are being provided now and expand those and extend those in order to support those people that are not able to transition to a more permanent solution.
So any further questions? Senator Daniels?
Thank you. Following up on that statement, the documentation says in the event the federal funds are no longer available, general funds will not be requested to support the program. But it sounds like what you just said, that you would be asking for general funds later to support those federal funds that aren't there anymore.
No, I should clarify that. And really kind of important maybe to another item later on is that under ERA 2, which is the second tranche of funding, obviously, that program allows us to spend until 2025. And so you'll see a later item here that takes a lot of the services and the programs that I described a moment ago, transitions those over to ERA 2, and enables us to continue to spend under that program until at least, at the longest we could go with that would be 2025. So effectively what we're asking here between these items is to fully utilize the ERA funding for the rental assistance and the utility assistance, and then to, in addition to continuing that program under ERA 2, shift the cost of those support services to ERA 2 because we have a longer horizon to spend those in order to avoid and to make sure that we're using federal funds for those programs.
Follow up.
Follow up? Go ahead.
Has the department been monitoring this program? I mean, this started back in the COVID, in the heart of COVID, with 2% unemployment. Right now, one would expect that maybe the numbers would have gone down because people are employed and now have jobs that they didn't have back then, and so maybe they don't need as much assistance with rental. Is the department been following that, monitoring that enough so that you could give us some sort of a historical graphing of what's happening?
Yeah, the level of monitoring that goes on with this program is pretty substantial. And in fact, most of it is right on the website with the numbers and where it's being used and how much is being used and the number of families that are being served and so on. I think the thing to remember too is that while we are definitely seeing the reduction in the unemployment rate, we still are seeing very, very low vacancy rates across the state. And a lot of those, particularly rent costs, are not seeing the same decrease as the unemployment rate. So it does remain a challenge for a lot of people.
Thank you.
Madam Chair.
Are there further yes, Representative Leishman?
Thanks, Madam Chair. So I have two questions. One is a follow-up to Representative Earth's questions. Do you have a rough idea how many people are being served? You said you didn't have a number, but you must have a rough idea.
I'm going to ask Chase to.
Hi, Chase Hageman, Deputy Director at Gopher. I made a note because I assumed this question would come. To date, we've provided over $200 million in assistance to over 21,000 households.
And a follow-up, if I could, Madam Chair.
Yes, you may.
Thanks. I don't believe we've seen any of the contractual language that you've had with the federal government for receiving these funds, but there's no like clawback language in there that the federal government will be looking for any sort of reimbursement from these federal funds?
That's a good question, Representative. There are reallocations within these programs that the federal government has already been engaging in. In fact, the $12 million from this item is $12 million being reallocated from other jurisdictions to New Hampshire to support its program.
Thanks. Thanks, Madam Chair.
Okay. Representative Edwards?
Thank you, Madam Chair. This is a general concern. I think you and I talked about this once in a previous fiscal committee meeting, and I'm just concerned with our vacancy rate of rentals as low as they are, as we continue to pump more money into chasing fewer and fewer facilities, that we are likely to be contributing to the inflationary nature of the rental increases, and we're exacerbating a problem for those who are chasing property that aren't receiving the benefit of government funds. And last time I mentioned it, I think it was the first time you and I had ever talked about it. I'm just curious, in the months since then, have you given any thought to that dilemma? And whether or not we have a valid cause to worry that we're a part of the problem?
Well, I'm certainly familiar with that concern, Representative, and I think that we are not the only state that is spending resources, federal government resources, under this program. I think the scope and the scale of the rental shortage and the costs in New Hampshire predated, in a lot of cases, the situation that we're experiencing right now. As you are aware, we've also requested and approved and are running a program called Invest NH, which is $100 million of federal program to assist getting more of these rental units online. I think exacerbating the situation pretty significantly is the increase in mortgage rates. As you see it more difficult to become for individuals and families to purchase a home, it continues to put downward pressure on our rental units that are available. So people are staying in rental units that normally, in sort of a healthy housing market, you would see this churn of people moving from, maybe a 1-bedroom to a 3-bedroom and then to a house. The leap to the house has become a bigger leap than it was just a few months ago. And so there's a number of factors that are going into the cost of the rental markets right now in New Hampshire. This, one could certainly argue is part of it, but it is a problem on a national scale, certainly on a regional scale. And we're trying to alleviate that with some of the other programs that we have running at the same time.
Are there further questions? I do have one, and you probably won't be able to answer it, but if someone is qualifying under this program, will they also be receiving LIHEAP money?
I think we might be able to answer that question.
Oh, good. Thank you.
It's a question that's come before, Representative. The way the systems are designed is the two are not competing sources of assistance. So there's a tracking mechanism to make sure those who are receiving LIHEAP are not duplicatively receiving ERA utility assistance. So to the extent that LIHEAP is unavailable to a household, then the ERA assistance steps in.
Okay, so that was my concern, that we were double dipping, if that's the right term. Okay, thank you very much. All right, are there further questions? Senator Rosenwald moves FIS 317, seconded by Senator Bradley. Will the clerk please call the roll?
Roll call FS 317. Representative Edwards.
Yes to 317.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote being 10-0, FIS 317 passes. We now move to tab 7, FIS 22300. This is also from Gopher. Okay. Are there, let me just go to my page here, 300. Sorry for the work being done downstairs.
I feel like someone's going to pop through a hole right here any second.
Yeah. Well,
A real
they have,
Yeah, a real life gopher.
yeah, a real life. Oh, that is really.
Sorry. I've been waiting for 2 years to use that.
Yeah, well, it's, I'll tell you what, it's not a bad thing.
We could jump into Caddyshack anytime.
Yeah. Are you sure are you sure this is the right career for you?
Yet to be determined.
Oh, yet to be determined.
Yeah.
Okay, fine. All right. Tab 7. 300. Well, I'm trying to find this. Yeah, in my book. Are there any other questions? Okay. This is authorization for youth and adult homeless shelters. Is that correct? If I
Youth and young adult.
Okay,
Yes.
youth and young adult. Is this in addition to the current homeless shelter beds that we have, or is this part of?
This is a separate item, Representative. This is a reallocation or an expansion of an existing obligated source for the youth residential services. So what we're trying to do with this item is use 10 million of the original 19 million that was authorized to get to a specific subset of providers under this program for under 22, I
Yeah,
believe,
I think
under
that's-
25 years old.
Okay, so
It was really in the original purpose of the original item, but for whatever reason, through some sort of lapse in the language, we weren't able to get it specifically to those younger those locations that serve younger populations.
okay, so they are different than our normal homeless
They're
shelters.
qualified as different in a way that we need to have additional authorization to get them those resources.
Okay, fine. Are there any further questions? Representative Erf?
Thank you, Madam Chair. So I posed this question in my queries, which apparently, I don't know if it got through to you or not, but related to what grants, because this is an ongoing program, and I was asking about what grants have already been made and to whom, et cetera. I'm guessing your answer is going to be it's on the website, which is a good answer. Could you provide us with it? Not right here in words, but could you email to Mr. Kane that website address so it'd be easy to look up this information?
Yeah, I mean, we could send you the website for all of the programs here.
That'd be great. Thank you.
This program here, I'll just reiterate too, is for capital improvement components of requests from these organizations.
But I assume it's also, the information is also probably on the website as well?
With regard to the specific, once they are approved by council, I believe that will be up there.
Right. So as I said, that this is, my understanding is it's an ongoing program.
Yes.
Many grants have already been authorized, so those will probably appear.
They've been authorized. They haven't been through council yet.
Oh, they
I think
haven't.
they're
Okay.
coming up the next meeting.
All right. Thank you. Thank you, Madam Chair.
Yes, are there further questions? Seeing none, could I please have a motion? Thank you. Senator Rosenwald, second. Second by Senator Bradley. Will the clerk please call the roll?
FIS 300. Representative Edwards.
Yes to 300.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley. Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes,
Madam Chair, the vote is 10-0.
the vote being 10-0, FIS 300 passes. We now turn to FIS 22302, the Department of Safety.
Good morning, Steve Lavoy, Director of Administration for the Department of Safety.
Good morning. Are there questions from anyone? Okay, I do have just a couple of questions, Mr. Lavoy. I saw your explanation about what you have left out there in these variable whatever they're called. I assume that those are the ones we see on the highway that say, you know, one death is too many, we're at 99 or whatever it is. Is this the signboards that we're talking about?
Those are the signboards that we're talking about, yes.
Okay. And you indicate that you loan these to towns for whatever?
Yeah, so these are boards that the Division of Emergency Services and Communications maintains primarily for emergency response capabilities. We use them for state purposes, coordinating with HSEM if they're needed, but locals can also request to utilize those boards. They can put a request in through the website form that's on the HSEM website, and those can be used locally.
And how long have you had the signs that are now not functional?
We've had them for well over, I'd want to say over 10 years.
Okay.
They're signs that are out in the elements, in the weather. They wear out over time. And we've been patching them together and keeping them running as best as we can, but we continue to lose functioning signs on a regular basis.
So it's not like 1 or 2 years. It's a long time.
It's been a while.
Okay. Thank you very much. Are there any further questions?
Second.
Okay, we have a motion by Senator Gray to approve, seconded by Representative Leishman. Will the clerk please call the roll?
FIS 302, Representative Edwards.
Yes to 302.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins-Spolka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote being 10-0, FIS 22302 passes. Okay, we now move on to FIS 22304 from the Department of Health and Human Services.
Nathan White, CFO, DHHS.
Good morning, Patricia Tilley, Director of Public Health.
Are there questions on FIS 304? Representative Edwards.
Thank you, Madam Chair, and thank you, Ms. Tilley, for engaging with me yesterday to prepare for some of this. I think New Hampshire does a great job. One of the things we need to do, I think, is given some concerns about the CDC coming out and admitting that oftentimes they made policy up as they want without the underlying science. I think that it's incumbent upon us that when we do something controversial and injecting kids under 5 and boosters over 5 turns out to be a controversial issue, I think it's important for us to demonstrate that we're following the science. And so we have a policy before us with $6 million of funding for the state to send mobile vaccines out. That's the policy. That policy should follow the science. Would you summarize for us what the science is that suggests that the department has done the state's due diligence to ensure that there's published peer-reviewed research to indicate that this is a safe and efficacious way to go?
Thank you for that question. So what we would say primarily, I don't know that I would necessarily agree with your characterization of the CDC. They have had some communications issues and others, but we're not here to discuss that. In terms of the science of vaccine, the way New Hampshire, and in particular Public Health and the Department of Health and Human Services, makes its decision is based on the data. We, led by Dr. Chan, who is our state epidemiologist and leading infectious disease expert, he is charged with reviewing all of the data, all of the peer-reviewed studies around safety and efficacy. Some of the questions have been around vaccine for children. We have monitored that data closely. We have seen that the current monovalent vaccines are safe and effective in ensuring that kids do not have the worst outcomes of COVID-19 hospitalizations or even death. We know that in New Hampshire that we've been lucky. We have only had one death of a child during this pandemic, while we've had over 2,600 deaths through the adult population. We continue to have about a death a day in the adult population of COVID-19. COVID has not gone away. So we are continuing to look at that data. We look at the broad effects from both the efficacy of the vaccine itself and balance that with the long-term effects of COVID-19. In children, we see long-term effects, even with those smaller numbers. We know that 20 to 29-year-olds are actually the age group that have COVID the most, but the 10 to 19-year-old population is up there as well. And we know that there are implications of essentially long COVID from children who have had COVID-19 infections. There are other outcomes from myocarditis, some impacts around diabetes that are really concerning. And so we think it is effective policy in order to have vaccine available to children and to adults. There's no requirement for COVID-19 vaccine in school or childcare. This is a decision that families can make for themselves and individuals can make for themselves as adults. But it is our job and it is our policy direction that we think we should make vaccine as easily available in every nook and cranny around the state, and our mobile vaccine services help us. We know that last year, we administered almost around 40,000 doses through our mobile vaccine services. So there was obviously a demand. Communities asked us for the van, we deployed it. There was no pushing of vaccine. This was in reaction to the input from our community members. We were also able to vaccinate over 2,000 homebound individuals. Again, individuals that had limited access to get that vaccine any other way.
I follow up.
Thank you, Madam Chairman, and thank you for that reply. I'm glad that Dr. Chan is reviewing all the literature. Is there a way to make available to the public a set of the literature that he's looked at that specifically supports the idea that providing this vaccine to kids under 5 and boosters to those over 5, that is safe and efficacious? And what I'm looking for there is actual academic research that's been published and peer reviewed, so that the public can understand and get a glimpse into the decision process that we're going through on their behalf.
Thank you for that question. We can certainly look into what the best way to share that data, whether it's on our website or others. As the committee knows, I shared a long literature review last night, looking at those very specific to around kids vaccine, but around the efficaciousness of the vaccine and also some of the other effects of COVID-19. We can work with our communications folks to determine the best way that we can make that available.
Okay, before you go on, I think that what we're looking for is not a list of the studies, okay, but rather kind of a Dr. Chan's summary, if that makes sense, because I don't know about everybody, but it would be nice to have a summary, and then if I want to go someplace else, I can do that.
Sure, we can certainly provide that.
Okay, thank you. Yes.
Thank you, Madam Chair. And then on a slightly separate topic, in the write-up, it says that this program is necessary to help students return to school, but the services don't actually start until October. And so, as I remember school kids, they've already begun to go to school. So is this just poorly written, or did we mean something else?
No, I think, as you know, we prepare these documents long in advance before they actually get to you. We are we want to, with these funds, we're going to bring them to, approved today. We will bring it to Governor and Council at the end of the month. That's a little bit later than we had originally anticipated. But regardless, whether it's for kids to go back to school or kids to stay in school, it's really important that we have access to vaccine. I think we have all felt, anyone with a child in their life, the impact of having to have a child be in isolation, out of school, and the impact that it has on their caregiver's ability to work. So I think we could word that differently, but I think that's an artifact of when we've actually started writing the letter.
All right, thank you for that. The reason I'm so picky is because this goes to the public and this is our communication, and it's important to maintain credibility, and one way to do that is to write precisely. So that's where I'm going with that. And if there are no other questions, Madam Chair, I'd be prepared to move to approve. But
Yeah, okay. Representative Irv?
Thank you, Madam Chair. So why does the state need to be involved in this vaccine distribution and not others?
That's a really great question. So I think if you look at routine childhood vaccinations, we have a long established process by which we provide free vaccines for children to all providers. We have a complicated way in which we work with the insurance companies in order to fund that so that we can have universal access to vaccine. That is a artifact of decades worth of work. And there's a routine to getting that vaccine. COVID-19 is still supplied by the federal government, again, separately than if I go to the pharmaceutical market to get the other vaccines. That's a different process. With the federal market, the Department of Health and Human Services, receives a tranche of vaccines. Another set of the vaccines go directly to some of the partners like pharmacies. There's a direct federal relationship between retail pharmacies and the federal government. There's also a direct relationship in other areas like federal corrections and, to a smaller degree, federally qualified health centers. So we are essentially the middlemen in this particular vaccine because of the way the federal government has procured it. It is also, we are still in the middle of a public health incident, so we are still managing this as an emergency. We certainly aren't using emergency powers as we did early in the vaccinate or the pandemic, but we are still controlling it on a day-to-day or managing it on a day-to-day basis, ensuring that we get vaccines to the right populations, ensure that there's equitable distribution everywhere instead of just leaving it to the free market on its own.
Okay. Senator Daniels?
Thank you. These services offered through mobile are still being offered through the pharmacy, or have they been discontinued?
No, these services are also available in pharmacy. I think right now those bivalent vaccines have just started to land in the state. You can get online and go to CVS and Walgreens. And so if you are someone who's capable or willing to go through an app and find a vaccine time and get yourself there, you can do that if that's the direction you want to go. What we found last year in particular, that the mobile vans made it more convenient for individuals. An example I often use is we were able to go to work sites, and again, the work site did not require the vaccine for its employees, but wanted to make it available. They understood the value in keeping their own workers working, and many of the workers wanted to participate, and we were able to send the van out in off hours for third shift workers. That's the sort of flexibility that the van provides for us. We can go to a certain event that if they invite us, we can bring there, and people can then take that opportunity to get their vaccine rather than trying to get an appointment either at their provider or at a retail pharmacy.
Follow up?
Yes.
So where does the department find the balance between personal responsibility and thinking that it's our job to go to somebody's door as opposed to them taking the time to go to the pharmacy on their own?
Sure.
Because there is a cost to that.
There is a cost, and I think that's something that we struggle with in public health, or we balance every day of what's personal responsibility and what's protective of public health. This particular strategy not only protects individuals, it also protects the community. We still have a valid interest in ensuring that we reduce and mitigate the spread of COVID-19. I think we've all learned how expensive those surges of COVID-19 are to our workplaces who lose staff, to those who have to stay home. We've seen the implications over and over. And and right now, as I noted, we're still having at least a person a day die by COVID-19. It was the third leading cause of death last year. So we're still making that balance.
Okay.
Are there any further questions? Representative Edwards?
Thank you, Madam Chair. As you know, I wrestled with making a motion to table, but I'm not going to do that. I just would appreciate a much stronger commitment by the department to have Dr. Chan sign a public-facing document certifying that he's reviewed the research and that he believes, in his professional opinion, that this is safe and efficacious for these age groups. I heard the department respond to it in general, but I didn't hear a strong yes. We will get it done. We'll get it done within a week. I'd like to hear something specific.
Thank you. I need to go back to the team to determine what is the best way. We agree in the intent of what you're asking. I think we can get there. I just don't know exactly what that would look like in this moment.
I'm fine with that. What I'm looking for is clear accountability, that we have an individual who says, I've done the research and this is good. So that's what I'm looking for. So thank you for your patience.
No problem. Are there further questions, comments? Senator Bradley. Okay.
Second.
Senator Bradley moves. Representative Edwards seconds. Will the clerk please call the roll?
FS 304, Representative Edwards.
Yes.
Emmerich votes yes. Representative Erf.
No.
Representative Leishman.
Yes.
Senator Daniels.
No.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 8 yes, 2 no.
The vote being 8 yes and 2 no, FIS 22-304 passes. We now move on to FIS 22-305 from the Department of Health and Human Services, dealing with 15 million in federal funds, looking at Solution Health. So, welcome.
Good morning. Red is on, I guess.
Yes, red
Green
is
would
on.
be on. Lori Weaver, Deputy Commissioner for the Department of Health and Human Services. Good morning. Do you have any particular question you want me to start with, or would you like me to just give a general overview to start of the item?
Why don't we start with just a general overview? I think that would be helpful.
Sure. So this item here for Solution Health, when we look at what the work of the department over the last several years of building a system of care, which is basically building services on a continuum from least acuity need to higher acuity need. We've spent a lot of time doing that. Since COVID, the increase in demand for higher acuity services has been there. And over the last year, the commissioner has been out publicly talking about working to find vendors to work with us to meet those services. As you may recall, back in January, one of those vendors was HCA, when we were here to submit and accept and expend for that money. Unfortunately, since that time, we have worked with HCA and have not been able to reach agreement, so we're not able to move forward at this time with HCA. We are able, however, to present to you the Solution Health, which is really the other vendor. So this vendor is coming to you now because we're here in front of Fiscal, but we have been talking with them for a while as well, and they are ready to move forward. It's the same prototype of a contract. So when we look at what we were asking for HCA and what we're asking for here, it's pretty much the same ask, which is to offset the capital costs for them to build services, and in return, guarantee the state access to services when we need them for that continuum of care for higher acuity services. It is our plan that should this be approved today, that we would go to Governor and Council with our request for that grant, which would detail what we would ask the vendor specifically to be doing in addition to the accept and expend. Most times we go to council for the accept and expend and come back with a contract. We are going to do that all together should this be approved here today.
Are there any questions? Representative Edwards.
Thank you, Madam Chair, and thank you, Ms. Weaver, for taking the question. I would just ask you if you could help clarify my understanding of the scenario here. When we approved essentially saying it's essentially the same deal as we offered HCA. Now we're offering Solution Health, which I understand is somehow affiliated with Elliott. When we cast that vote, I could have sworn that we were told that HCA had been identified because we had done our due diligence in the state and nobody else had wanted to bid or participate in an offer like that. And so to find ourselves a few months later now with Elliott basically saying that they'd be open to this, I'm curious, did the situation evolve? Did we not do the right homework up front? I'm just curious about that gap from going from only HCA is willing to do this to finding a replacement. And I'm happy about it, by the way.
Sure. I believe in terms of doing our due diligence, I believe that we did do that, and we did have two interested parties. At the time, HCA was the one that was able to come forward first with and be able to get to a point where we could ask for an accept and expend. Solution Health at that time hadn't materialized. So the commissioner has said publicly several times that we were looking at two vendors that could meet this level of service.
Are there further quotes? Senator Rosenwald.
Thank you, Madam Chair. Can you clarify whether the 25 DRF beds would be a net add, or is Elliott planning to close its DRF beds and move them to this new facility?
Sure, Marissa, do you want to?
And the other beds too, the voluntary beds.
Sure. So based on the letter of intent and discussions that we've had to date, you'll see on page 3 of the item, we have the inpatient's beds listed there. We have listed 25 beds, which is essentially doubling the existing capacity. Obviously, we couldn't it's not doubling because it's 12.5. But as I understand it, it would be a net increase at this point. However, ultimately, the final figures would be determined through negotiations and in the final agreement.
So the Elliott is not closing its inpatient units and using that space to do something else?
Not to my knowledge, no.
Would we be requiring that?
I think, as Nathan had said, I think we would go through negotiations. We'll know that, but I don't think we're planning on requiring anybody to close anything. What we're requiring is access to services that we don't currently have through that vendor.
Thank you. I wasn't thinking we would require Elliott to close their beds. I was hoping maybe we would require them to keep them open. I see that as of yesterday, we had 35 adults waiting for an emergency bed. So we haven't solved the ER boarding crisis, despite approving lots of millions of dollars. Are we thinking of giving Solution Health this money and saying, you have to keep these beds open, or are we not?
So if it'd be helpful, I can speak to sort of what we're envisioning for the larger agreement and how that would work, if you think that would helpful, because it kind of feeds into your question if you would like that.
I mean,
yes, go
I
ahead.
think we are all interested in
Sure, absolutely.
solving the ER boarding crisis.
Yeah.
I know we approved money for all the hospitals to open DRF beds. There were no takers this time. The HCA plan didn't move forward. I'm hopeful about this proposal. I know the Elliott and Southern are interested, but we have some leverage with this money, and I'm just hoping and that the department will use that leverage and wondering if you're going to.
Yes, so we fully intend to. So the agreement itself is going to look a little different than many of the contracts that we typically have. In this case, it would likely be an agreement that has two major phases. And the first phase is the construction phase. So during at which point the Solution Health would incur construction costs. They would submit invoices. We'd reimburse them for qualified payments. After that, once the facility would be ready to go live and start accepting patients, that's where we envision a 10, potentially 12-year commitment where they would be required to ensure certain levels of service, and there'd be required quarterly, monthly, annual, potentially biannual reporting requirements based upon the specific terms of those of that agreement. We would also ensure that there would be clawback provisions so that if certain levels of services were not provided, we would have the ability to claw back some of those funds and or extend the length of the contract. As we've been looking at this agreement, we've consulted with many different individuals to make sure that whatever the final agreement looks like, it will ensure that A, we have long-term access to services for the state, and B, we have the ability to take action if necessary, if the required services that have been outlined within that agreement are not met.
Thank you.
You're welcome.
Are there any further questions? Yes, Senator Daniels.
Thank you. On page 3, your justification for this capital ask seems to be based upon the COVID blip, which tends to be an anomaly in the whole course of things. So my question is since you're basing this on that period of time, what are you doing to address what happened during COVID so that it doesn't happen again? And does that maybe necessitate not the need for such a large facility or the services that are being asked for now?
Thank you, Senator Daniels. Marissa Henn, Associate Commissioner at DHHS. I think it's interesting when we think about an event like COVID because we don't yet know how long the impacts on a population level when it comes to behavioral health, how long that will last. We know from other mass events that affect populations, things like Hurricane Katrina, et cetera, that oftentimes the impacts from a emotional, psychological distress standpoint can last for decades. So many of our local and national and international indicators are suggesting that we may have an increased prevalence and acuity of behavioral health need for a very long time to come. That said, I think you raise an important question, which is how do we not restrict this just to the COVID phenomenon, but also build on all the important work that's been going on across the state to address behavioral health needs? And I think to the Deputy Commissioner's point, this is building on the 10-year mental health plan and the system of care work to really ensure that we have a continuum of services that we're offering, of course, still committing to that community-based objective of serving people in their homes, in their communities when possible, but recognizing there remains a need for that sort of tip of the pyramid level of acute care services, and that needs to be provided in more than one facility. And of course, that, you know, to the question of Hampstead, having these beds for children, for example, not just at Hampstead, but also offering it at a peer facility is a particular opportunity at hand.
Thank you.
Are there any further questions? Seeing none, Senator Bradley moves FIS 22305.
Second.
Second by Representative Earp. Will the clerk please call the roll?
FIS 305, Representative Edwards.
Yes to 305.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins-Coie.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote being 10-0, FIS 22305 passes. We now turn to FIS 22-312. Are there any questions from the committee? Representative Edwards.
Thank you, Madam Chair. And it's just an observation that this 312 has the same issues as the prior three that I isolated. There's nothing. It's 252,000. It's not a great deal of money, but when you read the explanation, there's nothing quantitative in here to give us an understanding of exactly what this 252 is going to do. What, if we're going to spend money, what does the end state look like? What is our goal? What's our objective? Is it measurable? Those are the kinds of things I think the fiscal committee needs to know about. And I'm not going to oppose this. I just wanted to make that point again.
Senator Rosenwald.
Thank you. I was sort of a chicken and egg question. You state in the narrative that birth centers are maybe increasing their deliveries because families are choosing not to have births in a hospital setting. But to what extent are we seeing this being influenced by the number of hospitals that are closing their birthing units?
Thank you. Oh, thank you. Patricia Tilley, again, Director of Public Health. Thank you for that question, Senator. We're not sure right now. I think that requires a little bit more study and a lot more detail of understanding where the individuals come from who have those births. So it's not surprising that many of those freestanding birth centers are in some of the more densely populated areas of the state. So they would still have access, as opposed to the birth closures that we've really seen cut across the middle of New Hampshire. Oddly enough, if you know Route 11 that goes east-west, it's roughly along Route 11. That's where we've seen the first round of big closures from Claremont all the way to the eastern part of the state. We have some closures up north. So, we would need to do more digging to figure out. We've just looked at right now, and we've certainly seen the numbers that all births in New Hampshire have gone up in 2020 and 2021. New Hampshire was one of the only states to have an increase in births in 2021. So it's hard to pull apart if this is just an artifact of it's the same proportion that are going, or if we're seeing a real increase. We know anecdotally what we've heard from the birth centers is that people are saying it was because of COVID. It was about a more personalized experience. It was about being able to bring people, especially in 2021, where you couldn't bring supportive partners to the birth. All of that has contributed to some of their growth, but I can't tell you definitively.
Quick follow-up.
Yes.
Thank you. I know that at some point the state was paying an enhanced payment to Androscoggin Valley.
Correct.
To keep their OB unit open. Are we still doing that? And are we doing that to any other hospital?
Well, thank you. Yes, it is my understanding. I am not Henry Littman, but I can tell you that we are still providing that enhanced payment to Androscoggin. Luckily, with support of the legislature, we were able to have an increase in all rates for birth centers, and in particular among those rural areas. So we're looking forward to that, moving forward, to have some increased rates for everyone. But Androscoggin has historically kept that rate. They have if we were to lose Androscoggin, that would be a huge deficit for us in the North Country.
Senator Daniels.
Thank you. In the course of doing business, I would look at insurance premiums, in this case malpractice premiums, as an ongoing operating expense. Mm-hmm. And so my question is, what's the justification of using one-time money through ARPA funds to pay for operating expense which are ongoing, as opposed to one-time cost?
Thank you, Senator Daniels. I think that's a very fair question. One of the one of the birth centers reported to us and reported to Gopher that their malpractice insurance had typically been from about $24,000, rose in 1 year to $68,000. Their volume is so small that they were unable to keep, that would be a rounding error in many other businesses, but that was enough to have them consider closing their doors. So I think this is a stopgap measure for 2 years to help them get back on their feet. We have some increased rates coming forward for the birth centers, so that should be able to equal that that balance of being able to provide one-time support and then support it with ongoing reimbursements from commercial and public insurers.
Follow up. So you state that in the event that federal funds are no longer available, that general funds will not be used, but I just heard you say that you'll be asking for more that basically would take the place of federal funds.
I would not characterize that exactly as being the general funds are going to take the place. Those rates were artificially low, and so those rates are rising to regular, closer to what it actually costs to do business. I don't know if you want to answer that.
I think that statement is specific to this program here, which is specific to targeting the malpractice insurance rate increases and not necessarily to the Medicaid rate program. We were thinking about those separately in that statement.
So are we actually playing a shell game so that when the federal funds stop, the malpractice insurance is still high, so you're just moving money from the general fund that you get now over to cover the malpractice insurance and asking for more through the general fund?
I don't necessarily think I would characterize it in that manner. I mean, the way that we were envisioning this in conversations with Gopher and others was that this would be, as Director Tilley pointed out, this would be the one-time stopgap measure. The rates have been increased. That was approved by the legislature this past session. So we kind of see these things as two separate items. I don't know if I would characterize it in the same way. I don't know if you'd like to add.
No, I mean, I think what we would see with any rates, it covers the broad spectrum of costs associated with doing business. Malpractice is one part of that, but it's across the board, all of whether the professional service fees and the other fees that are required to do business. So as noted, the fees are to support ongoing costs. This is a one-time effort to address this one big leap in malpractice insurance that they've seen in 1 year.
Are there any further questions? Yes, Representative
Oh,
Edwards.
okay, thank you, Madam Chair. Throughout the day, I've pointed out 4 of these requests that I thought needed stronger quantitative analysis, and I just didn't want to leave it without giving you an example of what I'm talking about. So if you look at 314, we did not, you don't have to do it now, but we're not pulling it off the calendar in large part because whoever ghost wrote this for the commissioner's signature did a fairly nice job in that last paragraph, giving us some numbers that we can begin to wrap our head around. So I wanted to give you an example of the kind of thing that would be helpful in the future. So I didn't want to just be negative. This is a positive thing. This is what I'm looking for.
Sure, and maybe we can have a conversation offline about some better details and outcomes and whatnot that you're looking for.
Okay, are there any further questions? Seeing none,
Move the item.
Representative Leishman moves. Do I have a seconded by Senator Bradley? Will the clerk please call the roll on FIS 312?
FIS 312. Representative Edwards.
Yes to 312.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
No.
Senator Bradley. Yes. Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 9 yes, 1 no.
The vote being 9 in favor and 1 opposed, FIS 22312 passes. We now turn to FIS 22313, 313, again, Health and Human Services, dealing with emergency shelters. Are there questions from the committee? Senator Bradley.
Thank you very much. I just wanted to get into the record the conversation that we had the other day, which I believe addressed all of my concerns. When the Senate looked at this idea of providing funding for homeless services, we did it in a different manner, mainly because many of the small towns in New Hampshire have limited options in terms of services, especially in the northern part of the state. So I wanted, and the Senate, I think, wanted to ensure that for those towns that the only real option for them is to place homeless individuals in motel or hotel rooms, that this would allow for that kind of service, the $1 million, to be utilized in that manner.
Now I'm on? Okay. Thank you. I can't figure this out. Thank you for that question, Senator Bradley. Chris Santinello, Associate Commissioner. And yes, that would be allowed within the funds that we allocate for those communities. Absolutely.
Further?
Yes, please go ahead.
And so a town like Conway, which both the chair and I represent, that we know have folks that are homeless right now, when the cold weather comes, the town of Conway, for instance, and I'm just using it as a for instance, would be able, either through a not-for-profit agency or directly, to come to the department and be able to access these funds.
Thank you, Senator Bradley. My name is Karen Hebert. I'm the Director for the Division of Economic and Housing Stability. So yes, for example, the Way Path organization up in Conway that is trying to seek further funding for their program that would be very applicable to this, for this funding, that would they be able to strengthen their program there. So looking at just those organizations throughout each county and their unique needs, that would meet that.
So if I might, Madam Chair?
Yes, please.
The town of Conway then could work with Waypoint or the Carroll County, the
Yes.
county, to access these funds to be able to utilize motel accommodations, if that's what the best option was.
Yes, absolutely.
Perfect. Thank you.
Are there further questions? Representative Leishman.
Thanks, Madam Chair, and thanks for your explanations. But I'm reading through your letter that you have, and you talk about the number of shelters available or beds in the state, and it's far not sufficient for the ones we need. But I also noted that you do not provide any funding for temporary cold weather. Could you tell me why?
Sure. Chris Santinello again. That's just not a program that the department has had funding for. Typically, that occurs through municipal dollars, community fundraisers, but we have very limited dollars in this program area, and so we use it for year-round shelters.
Thanks, Madam Chair. Thank you.
Okay, but I thought it said some of this money could be used for the cold weather shelters.
Yes, we're going to do, it's divided up. We have allocated $1 million for that, yes.
Okay,
But typically, we don't fund those.
okay. And are there further questions? Representative Edwards.
Thank you, Madam Chair. I expect that 313 is going to pass in an overwhelming way, and so I want to explain why I'm going to vote no. It's got nothing to do with what the department has done. It's simply a process issue. The basic outline of this proposal was with the other body in the legislature at the beginning of the term. It was held within that body and never sent over to the House. So the House Policy Committee has been excluded from reviewing and approving of this policy. I think they may have, but in order to make the point that we have a bicameral system, and this had an opportunity to go to the House for review, and it wasn't. I'll be voting no, because this is a process crime in my view. Not a crime, but that's just a saying. It's a process foul. How's that? All right. So thanks.
Okay, thank you. Further comments, questions? I do know that folks are anxious to know how to apply for this money. Do you have any idea how long it will be until something can come out?
We are working on expediting that process right now. So hopefully it would just be a matter of weeks, subject to further approval.
And I assume the application would be on the website?
I'm sorry, I didn't hear you.
The application would be on the website?
Oh, yes.
Okay, thank you. Any other questions? Seeing none, could I please have a motion? Senator Bradley moves to approve, seconded by Senator Rosenwald. Will the clerk call the roll?
Roll call FS 313. Representative Edwards.
No on 313.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes,
Madam Chair, the vote is 9 yes, 1 no.
the vote being 9-1, FIS 313 passes. We now turn to FIS 315, which is sort of related to 317 that we passed earlier. But if I could, this is from the Gopher office. Welcome back.
Good to see you.
Yes, yes. Are there questions? I see Representative Rosenwald, you have your microphone on.
Oh.
Oh. Okay. Are there any further questions that were not answered when we discussed 317 earlier? Okay, seeing none. Is there anything you would like to add?
No, ma'am. I appreciate your interest.
Oh, okay. Thank you. All right, Senator. Second. Senator Rosenwald moves, seconded by Senator Daniels. This is on FIS 322-315. Will the clerk please call the roll?
FIS 315. Representative Edwards.
Yes to 315.
Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote being 10-0, FIS 22-315 passes. We now turn to FIS 22-316, also from the Gopher office. Not the Gopher. So, are there any questions? Senator Rosenwald.
Thank you. Just curious, if the business goes out of business, is the state in any way on the hook to repay the federal government for those funds?
No, ma'am.
So we have no risk.
No.
Thank you.
Are there any further questions? Representative Erf.
Thank you, Madam Chair. Do you have any idea why so many businesses fell into this recoupment?
Yes. Well, first of all, I mean, I should go back. to the underlying programs that this is sort of helping us get to the end of. Back in CARES Act under Main Street Relief Fund, and there was a self-employed program. There was around $500 million of aid that went under those programs to businesses across the state, to roughly 12,000 small businesses. Over the course of time in early April 2021, we did see that there were going to be some businesses that were going to fall into the recoupment category under the federal rules. Through a series of programs, we've now gotten that down to roughly about 300 of small businesses left of those original 12,000. Not all of them obviously face recoupment. But we're down to basically 98% of the program is in a situation where there's no recoupment necessary. So it really is at the end. We're giving a final option for businesses to choose, if they so choose, to extend the ability to repay whatever they might owe under the recoupment requirements for a period of 2 years at 0% interest. So this is like the very last opportunity.
A follow-up? But you didn't quite answer my question. And maybe you can't, which if you can't, that's fine. But I'm just curious as to why did so many businesses, maybe I shouldn't say so many, why did they fall into this recoupment?
Well, I mean, the simple answer is that a lot of businesses did better than they had anticipated they would do when they applied for the initial program. So if you recall, the way the program worked was that we asked businesses to project what they anticipated losses were going to be over the course of the next couple of months. And we paid a percentage of that, which I believe under most programs is around 17% of their projected losses. We gave them a grant in that amount. There were businesses, however, that ended up not losing the amount of money that they anticipated they would have lost. And so that put them in a situation where we had to offer them options to offset that. And we did that through programs like offsetting with COVID expenditures. We did that with a recoupment program where there was another program they could credit against what the potential recoupment was. And that's how we got it down to the 300 number that we're at right now.
Thank you.
Yep.
Are there further questions? Yes, Representative Lynn.
Thank you. Can I ask a question? Has there been some effort made to ensure, or will there be some effort made to ensure that before we're, giving sort of loans to some of these companies, that they're not sort of under investigation by either the Attorney General's office or the feds for some kind of fraudulent activity in connection with the original loans?
Yes, sir. Absolutely. And that's something we monitor very, very closely. Thankfully, we have not had many cases in those categories, but that would absolutely be part of any review we would be doing to offer these loans.
Thank you.
Are there further questions? Seeing none, could I have a motion, please? Thank you, Senator Bradley. Seconded by Senator Daniels. Will the clerk please call the roll? Representative Petrie, would you please come forward?
Roll call FS 316. Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Representative Petrie. Senator Daniels.
Yes.
Senator Bradley. Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote being 10-0, FIS 22316 passes. Okay, we now turn to tab 8. The first item on in tab 8 is FIS 294 from the Department of Justice. I know you've spent a lot of time with us this week, and this just one more.
I'm excited to be back.
I thought so. Okay. Would you mind just giving us a brief overview of what you're looking for, please?
Not at all. So thank you, Madam Chair, members of the committee. For the record, John Fromell, Attorney General, and I'm joined by Kathy Carr, our Director of Administration. So this is the request that we bring before the Fiscal Committee one, sometimes more times per year, for funds in our litigation fund. The litigation fund is used to support the department's efforts to both defend the state in civil litigation and prosecute. So for our criminal bureau, enforce the state's criminal laws. It's used to support the Environmental Protection Bureau, which enforces the state's environmental laws. It's used to support our Consumer Protection Bureau, which enforces our consumer protection laws. We do both civil and criminal work in the Consumer Protection Bureau. And it is meant to be used sort of as a supplement when we have needs at the department that go beyond what our internal resources can support. This is a larger request than normal. So that goes without saying. This is a particularly large request. And I think that stems from a couple of things. I mean, it's multiple factors, but two primary factors. One is that I think the state is dealing with more complex civil litigation at the moment than it typically deals with. I'll go through it, but that consists of YDC and the litigation associated with that. It consists of a major school funding case, one that is much closer to trial, and that's now been paired with a second school funding lawsuit that was filed earlier this year. Consists of two major federal court cases in which we're defending the Department of Health and Human Services, multiple cases regarding redistricting and election law, and the list goes on. But the department is dealing with more complex civil litigation right now than it typically deals with. It's also not just about the number of cases that the department's dealing with. It's about where those cases are in the process. So the further you move along in a case, the further you move through discovery, the closer you get to trial. If they're complex cases, the costs, the funding needs at any time get higher depending on where you are in the case. And so it's not just that we have more complex civil litigation, but we have a few cases that have come to a point where they require some significant funding. So that's one general reason, I think, why this is a larger request than normal. And the second is that the department has, and I won't go through the entire organizational chart, but we have a lot of internal resources. We do a lot of different things, but one kind of general function of the Department of Justice is to assist every state agency and state government. We represent every state agency. We give legal advice. We lend support. And I think across state government, as we all know, we've seen challenges with recruitment and retention, and that puts a lot of burden on state agencies. And because we serve every state agency, I think agencies require more support from us than normal. And so we're using our internal resources for that. And internal resources that we use for that client counseling function cannot be used for litigation. So those are two. I wanted to just give that overview to sort of explain why this is a larger request than normal. I think those are two factors that contribute to that. So with that, I'll just walk through the major cases that we're talking about.
I'm not sure that's necessary.
Okay.
You pretty much put that in the thing. So are there, Senator Rosenwald?
Thank you, Madam Chair. Just a question on the smallest thing in here. The election law. Do you expect, or have you already hired any outside counsel on either of these two redistricting cases? Or is this incurred in-house?
We have not, and I think the expenses we're expecting there are for experts and potential expert testimony. We have not retained outside counsel for those redistricting cases. It's possible we may, but at this point, my goal and my intent is to use in-house resources for those cases.
Are there any further, Representative Leishman?
Thanks, Madam Chair. Thank you, Attorney General. Is it fair to say that some of the recoveries or settlements that you've received lately would more than cover this request, the funds that you've received?
Yes, I mean, those recoveries don't go into the litigation fund, but I think it is fair to say that the department has brought in far more money in this calendar year through settlements and recoveries than this litigation fund request.
Are there any further questions? Seeing none, could I have a motion to approve?
Move the item.
Thank you. Representative Leishman and seconded by Senator Rosenwald. Will the clerk please call the roll?
Roll call on FIS 294. Hamrick votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Representative Petrie.
Yes.
Senator Daniels.
Yes.
Senator Bradley.
Yes.
Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
Thank you very much.
Thank you.
FIS 22-294 passes on a vote of 10-0. We now turn to tab 9. And FIS 22-319 from the Department of Administrative Services. I believe that we can talk about 319 and 320 together, since one is the program and the other's the money. Okay, so Commissioner?
Okay, so I want to emphasize, I'm Charlie Arlinghouse. I'm the Commissioner of Administrative Services.
And I'm Sherry Rockburn. I'm the Assistant Commissioner.
I want to emphasize a couple things. There are a bunch of different things in this package. So we're here performing more of a ministerial function. So I can talk about the what and the why. There's a whole host of commissioners and commandants behind me who will no doubt explain all of that to you why. It's essentially a group of recruitment and retention packages for a variety of officials. State police. There's a few people at the fire academy. I'm going to get that wrong. Fire safety personnel, correctional personnel, veterans home personnel. And there's also I left somebody out. Nurses generally across state government. And then in addition to that, there's a winter maintenance retention program. So think of highway maintainers, but that program will be extended to other people in state government who have a CDL. So people who don't normally participate in winter maintenance could, if they chose and they have a CDL, a commercial driver's license, participate in winter maintenance. It's a sum of recruitment packages, which was, I think, discussed, a sort of a significant conversation between various people in the governor's office and various people in these agencies who will be affected by this in ways to both retain personnel in the case of retention payments, and in the case of recruitment payments. A lot of people, like correction officers, for example, have an opportunity to get a bonus if they go somewhere else, and this will allow us to keep them. The commonality, I believe, between all of these items is that they are functionally 24/7 facilities, as opposed to anything else. And I'll just note that there's nobody in my department who gets a dime. So I have no conflict.
Okay. Yes, Senator Rosenwald.
Thank you. My question is really specifically about the retention piece. My understanding, this is one-time money that is pretty significant. It looked to me like $10,000 per person.
It is.
And I'm trying to think what happens at the end of that when the individual's compensation goes back down by $10,000? Are we going to see people leaving state government? And what do you think we're going to end up needing to do on the ongoing compensation? And I
Well-
realize that you don't get to negotiate the contracts, but what do you think is going to happen to the vacancy rate when people see their compensation fall off?
I think I want to emphasize that it's not pay. I mean, it is pay, but it's not ongoing in your paycheck. It's a payment, in some cases a one-time payment, or in some cases two payment tranches. So it really is in the effect of it'll feel like a bonus as opposed to a ongoing compensation increase. I think it's for any employer, the challenge with paying things like bonuses to sign on, $5,000 to work at Dunkin' Donuts. It's probably not 5,000 at Dunkin' Donuts, but significant. What happens then? Do people shop around a year later? And I think that's going to be a question. I think historically, if you look at, and I don't have data on this, but historically, if you look at things like signing on bonuses, they tend to occur in times where there's a particularly tight labor market and not be an ongoing basis. There's not a reset. They go in waves, and they tend to go in waves everywhere. That is to say, tons and tons of employers are offering them, and then tons and tons of employers are not because the labor market loosens. And I think that's where we would be. I don't honestly think the state government can. This is extraordinary, quite possibly unprecedented in our history, and it's sort of a storm of a particularly tight labor market right now, and the availability of ARPA funding. And both of those two things are quite unusual, and the likelihood of them appearing at the same time again, ARPA 4 and another tight labor market is slim. So I don't think it'll happen again. And I think it's probably incumbent upon most managers to explain to employees that this is unusual and this probably won't happen again.
Representative Perkins Quokka.
Thank you, Chairwoman. You got it exactly right. Thank you, Commissioner. And I guess just as a quick follow-up to Senator Rosenwald's question, I mean, yes, this is absolutely an extraordinary labor market. That said, as a housing advocate, I've been listening to our businesses talk about a shortage of workers for years now. So, I think the question goes more to this may be a one-time program, but in the long term, I mean, the state government may benefit, and I guess I'm asking for your opinion here in seeing higher wages just to ensure that we are, retaining talent at the state level and not seeing turnover at a place where institutional knowledge is really valued.
I think it's probably very important, my understanding, and, I can't speak for the governor or the bargaining team or any of that, but my understanding is that, this is a program to deal with one subset of state workers, but there's a general recognition that state workers, broadly speaking, have greater issues, and some of that's related to things like inflation. When inflation is 1.5%, 2%, people don't pay a lot of attention to it. When it's 9%, and you kind of do, I'm thinking a lot more about my oil payments than I did the last couple of years. So I think that's a thing. And I think without question, we need to figure out better ways to attract talent. And there's no question that wages are part of that. Housing is also part of that. I mean, I'll note that on the Governor and Council agenda yesterday, or whenever we were on top of Mount Washington, the air was thin. I don't remember well. Somebody resigned from a position, and one of the things they said was that, it's really hard to buy a house, and so they're going to move to Wyoming. And we probably need a little bit less of that. And I'm just glad I have a house.
Would you like to discuss the total money part, which is in 320?
I'm sorry, can you say that again? My
Yeah.
hearing's bad.
320 is dealing with the money.
Yes. Sherry, can you walk through the money quickly?
I think the most helpful chart or table to look at is the money on page, or the table on page 12 of 13. It takes up almost the whole page in the packet. I think that's a really good summary, though, of the programs and the funding. So I'll give you a minute if you have that page open. You'll notice that the first, 6 or 7 items are all funded with ARPA funding. And that is just under 13.5 million. And you'll see 2 numbers on the bottom, the winter maintenance programs through the Department of Transportation. And those funding is coming, 4.3 million is a transfer from highway surplus, and around 400,000 from the Turnpike General Reserve account. So that's the breakdown, 13.5 coming from ARPA, and just under 5 million is from transportation, highway, and turnpike funding. And that's strictly on the winter maintenance is where turnpike funding is coming into play, and highway.
I would just note that this particular chart, Sherry did, obviously not me, in response to my 18 different questions, which used a different number for the total each time. And I think she realized that if my little pea brain could get confused, so could other people's. And when she was up until midnight at the office doing this, at one of those late hours, she came up with this chart, and I think it's remarkably helpful, at least to me.
The only other thing I would add to that is under the initiative, I can just talk real high level about the incentive programs that fall under that. It doesn't have the dollars with it, but I can just very quickly kind of go through that. So the first item, the safety for the new full-time state police sworn personnel, that is a $10,000 bonus paid as soon as practical upon hire. So that's a lump sum that happens at the front end of that hiring. They do have to sign an agreement that says they will stay in that position or similar position for up to 1 year, subject to payback at the end of that year if they choose to leave state service or take a position that's not related to the one that they were hired into. The next one down is for the existing sworn personnel at state police, and existing is also 10,000, but that is paid in 2 lump sum payments of 5,000 within as soon as practical upon this passage, and then a second payment in March, April, springtime period. I don't have the exact date on that, but that's 2 lump sum payments, 5,000 each. The third one down for safety is the fire safety area. There's about 9 positions that are in that. That follows the same any new hire would be the 10,000 up front. The one underneath it is for existing, and that is 5,000 split sort of fall, spring. Then you'll see that corrections has both a new and existing. They follow that same logic, a new correctional sworn personnel, 10,000, and then a 5,000 split. Correctional also has a little bit different item here. This is a retention incentive. It's a 15% enhancement for their nurses, their direct care nurses at the institution, at their correctional facilities. Nurses currently have a 15%. This is an additional 15% that they'll get for a 1-year period. Normally, enhancements only go through the governor and council process. So New Hampshire Hospital has an enhancement, Glencliff Home, Sununu Youth Center. So that normally agencies fund within their existing budget. So it's not something that normally fiscal would see. It usually is just a government council item. Corrections can't absorb this increase within their existing budget, so they've asked for ARPA funding to approve that additional 15%. But all the other institutions that have the nurses at the government council meeting on Wednesday received approval to have that additional 15%. So they look a little different, but it's just because of their funding stream. The Veterans Home, this is a $2,000 payment to all of the staff at the Veterans Home for full-time. There's a $500 payment for part-time. Back in June, the Veterans Home received approval through Fiscal of a retention program through Fiscal and GNC for direct care to receive this incentive payment. This is for the non-direct care staffing at the Veterans Home. And this would be payable in November time period as a lump sum payment. That's the sum of all the ARPA funding. And then the last two on transportation, that is a $5,000 in total payment. And that is split 2,500 at the beginning of the winter maintenance period and then 2,500 at the end of the winter maintenance period. It would get prorated for anyone that gets hired in between and doesn't either, isn't there for the entire winter maintenance period, which is runs about November 1st through early April. So that's sort of a high-level summary of the individual items and then the funding that goes with it.
Thank you. Are there any questions? Seeing none, could I have a motion to accept FIS 22-319 and FIS 320? Okay, Senator Bradley and Representative Petrie. Will the clerk please call the roll?
Okay, this is for FIS 319 and 320. Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Representative Petrie. Yes. Senator Daniels.
Yes.
Senator Bradley. Yes. Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Quokka.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote on 319 and 320 is 10-0.
Okay. The vote being 10-0 on FIS 22-319 and FIS 320, both pass. Thank you. Okay, we now turn to FIS 22-301. This is Public School Infrastructure Fund in tab 10.
Sure, Madam Chair, that's 303. I think it's possibly
Oh.
just the stamp.
Yeah.
Okay.
Sorry. 22-303. Department of Education. I can't read. Oh.
For the record, Frank Edelblut, Commissioner of Education.
Fallon Reed, Department of Safety, Homeland Security, Emergency Management.
Would you just give us 3 sentences on the program? And then we'll...
Sure. So this is a program to improve the security in our school buildings. The programs are primarily focused on, go ahead, access.
Yep, 3 categories: access control, emergency alerting, and surveillance. And the first round of funding, all public schools were eligible to apply. And we had about $3.8 million left over from the original Public School Infrastructure Fund. The account earned a little bit of interest because there was 3.3, but now we're up to 3.8 and some change. So this is to award 177 applications to 92 different schools across the state.
Okay. Thank you.
Sure. There is, ma'am, if I may, the second round of funding, that's $10 million that we're working through those applications, but what's before you is for the first round of applications.
Okay. The object was to get it out the door as quickly as possible.
Yes, ma'am.
Right. Okay. Are there any questions on the public school infrastructure? Representative Leishman.
Thank you, Madam Chair, and thanks for your
Yeah,
good brief discussion. So I looked back, the department presented at some length a 42-page document showing other grants for security enhancements. And I noticed in that particular document, there were some issues like Hudson got $300,000 for a sprinkler system under the same program. Now, most of the items were for security cameras, doors, locks. Now, in your request, are there any outside of security issues, or are they all for security?
Right. So that first tranche of funding was used for safety, which included some safety measures, security measures, as well as some, broadband measures as well. There were some awards for that in there as well. This is specifically for security only. So these projects are going to be limited to those 3 categories that Fallon had mentioned.
And just one follow-up, Madam Chair.
Please, go ahead.
Thanks. I noticed in your request this time, for instance, Salem was looking for maybe $208,000, and they got $100,000 because you set a cap of $100,000, and yet there were a number of other smaller schools. I'll take my community. There's a charter school, and they were looking for like $96,000 or $98,000. How did you determine who gets what, where the cap came from? Because for a small school to get, say, the 90-somewhat thousand dollars, but Salem, with a much greater school population, they only got 100,000 on their request.
Sure. So I can speak to how we did the risk ranking, but the commission decided to do the $100,000 cap. So once we received all the applications, my office at Emergency Management reviewed each of the applications, and we had 5 questions that were part of the application that helped us do the risk ranking. And depending on the answer, they either got 1 point or no points. And so the highest potential score was a 7.0, and the lowest that was given was a 2.0, and then we had an average of 5.9. So we had based the questions were pretty standard. Have you submitted an emergency operations plan within the last 12 months? Has your school had an assessment completed by emergency management? How many security assessments have your school had since we started the program in 2014? A reference to emergency drills, how many of them have been emergency all hazards? And then have you submitted your current floor plans to first responders? So that allowed us to do the scoring, have a risk ranking, and then we had categories or tiers that we looked at for the score. So there were 5 different tiers. The application scoring below average in the categories of access control and emergency alerting were put first. So we did as many applications as we could at that point with the cap of 100,000. And then we looked at tier 2, which was application scoring below 5.0 in surveillance, and then we went there. So we kept going down to the different tiers until we reached the cap of the $3.8 million.
Okay, thanks. Thanks, Madam Chair.
Are there further questions? Seeing none, could I have a motion, please? Thank you, Senator Daniels. Second?
Second.
Second by Senator Bradley. Will the clerk please call the roll?
FIS 203.
No,
Two- What is it?
303.
303. This book's got 203. Oh, I'm sorry, it's a typo. Sorry about that. I have a typo, but that's all right. All right. This is 303. Emmerich votes yes. Representative Erf?
Yes.
Representative Leishman?
Yes.
Representative Petrie?
Yes.
Senator Daniels?
Yes.
Senator Bradley?
Yes.
Senator Gray?
Yes.
Senator Rosenwald?
Yes.
Senator Perkins Quokka?
Yes.
Representative Umberger?
Yes.
Madam Chair, the vote is 10-0.
The vote being 10-0, FIS 22303 passes. We now move to FIS 22280 from the Department of Health and Human Services.
Nathan White, DHHS CFO.
Karen Hebert, Director, Division of Economic and Housing Stability.
Okay. Let me get to the right place. Are there any questions that anyone has? Representative Erf?
Thank you, Madam Chair. So other than moving the cliff to a higher income threshold, bringing more people onto food stamps, how does this address the cliff effect?
The intent is that so individuals could continue to pursue employment or pursue a promotion in employment where they would increase their income. But oftentimes that isn't quite enough to be able to continue strengthening their own economic condition. So what this does is still enable them to be eligible for SNAP benefits. That way they can continue to strengthen their own position with that added income. Then slowly be able to, instead of suddenly not being eligible any longer for those benefits and experiencing that loss, they'd be able to just use that extra income over time to be able to just strengthen their own situation financially.
So I thank you that, and I understand that. That's moving the cliff. But that doesn't take away the cliff effect, correct? They're just going to run into the cliff a little bit higher up in their income.
I would characterize it more as reducing or mitigating the cliff, not necessarily eliminating the cliff. This is an attempt to try to reduce that sudden loss of those benefits. So I'm not sure that there are particular actions that can completely eliminate the cliff, but this certainly mitigates it and reduces it.
Are there further questions? Representative Lynn?
Yes, can I ask you, just ask a question? The limit right now is up, am I correct, is 180% of the poverty level? Is that right?
185.
185, I'm sorry.
That's okay.
And that 185 was established, how did that get established?
That's a good question. I believe it was set into law, and I don't know the history of that, but I could certainly find that out and get that for you.
So when you, I guess, do you know, maybe did you know this at this point? Was it, when you say it was set into law, was that by the state legislature or the feds?
I believe the state has the discretion of determining the eligibility, which is why we're able to change the percentage now through this process.
Okay, so I guess the only question I have, and it's really sort of a process question, maybe addressed to everyone, really, is if the legislature set the current limit at 185, I guess I raised the question of, is it appropriate for this body, which represents only a very small percentage of the whole legislature, to change the number from 185 to 200?
Sure. So I guess to start, I'd like just to go back to HB2 from this past session. There was a provision in there, it's Chapter 91, Section 34, that specified that any modifications to that threshold would need to be both approved by the House and Human Services and Elderly Affairs Committee, as well as the Fiscal Committee, and that's why we're here before you today. Chris Santinello just reminded me that that it was originally set up in administrative rules, which goes through the jail card public process, which is directed by statute.
Okay, so you're saying that statutes contemplate that there will be some change made by other than a full vote of the legislature.
Precisely, and I believe, I can't speak to the rationale, but I believe that's why an HB2 provision was put in this past session, so that there was greater oversight and transparency to that process.
Great. All right, thank you.
Are there any further questions? I do have a couple, I guess. I know that SNAP benefits affect other areas. So by increasing the percentage, what other programs are going to be affected by this change in the SNAP criteria?
There are no other eligibility programs that are certainly not adversely impacted by this particular change. So the information that I had provided in an answer to that, it certainly does make more individuals eligible automatically for Head Start who have children of that age qualifying. There are also education and training benefits that people will qualify for because of receiving SNAP benefits, including job search and the ability to pursue credentials that would result in a higher paying job or a high demand job. They would also qualify for the free and reduced meals through the school. And with an agreement that we are putting together with the CAP agencies, these are individuals with their permission would be contacted by those CAP agencies regarding LIHEAP benefits that they would qualify for. They also qualify for what's known as the Double Up Food Bucks program, which is an incentive for purchasing healthy foods.
You probably don't know whether or not these children are currently eligible for free and reduced lunch. Or is the answer to that, I don't. Does anybody? I'm talking about, the the differential.
So so if you're 185% of federal poverty level or below, you would qualify for free. If you're 250% or below, you would qualify for reduced price lunch. So between 200 and 185, is that the question?
Mm-hmm.
Yeah. It may be difficult for us. So right now we direct cert SNAP students. So given this change in eligibility criteria, we may have to do some additional work to be able to parse the students between free and reduced, but we can work on that.
Okay, so we have no clue what that number is.
Because it's yet another tier.
Yeah, I got it. We'll know that before the budget cycle, right? So the only thing that would truly affect the state budget is the free and reduced lunch eligibility.
Yes, potentially.
Okay. And then LIHEAP, sure, certainly.
I mean, we would probably need to look further at it, but depending upon how this change in classification is recognized, like Health and Human Services at the federal level may recognize it for one thing. Some of that same information is used by the U.S. Department of Education to determine specific funding levels relative to some of our title programs. So I'm not sure how U.S. Department of Education would recognize these shifts, these changes in terms of their funding allocation formulas on the education side at the federal level. Does that make sense?
Well, yeah. I think we better have somebody come back and talk to us in November about that, I think. Because we just need to know, what's happening.
Just if it's helpful, I can tell you that there are a number of other states, maybe 20 is my guess, including Massachusetts, that have moved from the 185% federal poverty level to 200 already. So on the federal level, it may have been resolved.
Well, we'll see. Anyhow, we'll look at, I don't think I have anything particular scheduled for November, but I do think we need to get a clearer understanding of the impact that it's going to have on the budget. Representative Erf.
So these are all federal funds, correct? And we're raising the eligibility rate here.
That is
And you
correct.
just said Massachusetts or some other states have it to 200%.
That's
Can we
correct.
set it to 10,000%? Is there any limit, in other words?
That's an interesting question, Representative. I don't know that there's a cap on the percentage, but I would anticipate that with a need to be reasonable for the purposes of SNAP to, address poverty, that it would remain, within the percentage that we're looking at and not what you're suggesting.
Well, you just suggested it go up to 200% in some states. What percentage are we looking at? 500%, 1,000%?
I don't know that anyone is looking at that.
And Chris Santinello just indicated to me, we can go back and confirm this, but it's our understanding that 300% is the max currently allowed by federal law.
Okay, are there further questions? Okay, yes,
Madam Chair, I move to table.
I have a motion
Second.
to table, seconded by Representative Erf. Will the clerk please call the roll?
Motions to table on FIS 280. Emmerich votes yes. Representative Erf.
Yes.
Representative Leishman.
No.
Representative Petrie.
Yes to table.
Senator Daniels.
Yes.
Senator Bradley. Senator Gray.
No.
Senator Rosenwald.
No.
Senator Perkins Wolka.
No.
Representative Umberger.
No.
Madam Chair, the vote is 4 yes, 6 no. So the motion fails.
The tabling motion fails. Did you want to make a different motion?
Move to approve.
Okay, thank you. Do I have a second? Representative Leishman.
Okay. This is a motion to approve FIS 280. Representative Emmerich votes yes. Representative Erf.
No.
Representative Leishman.
Yes.
Representative Petrie.
Yes.
Senator Daniels.
No.
Senator Bradley. Senator Gray.
Yes.
Senator Rosenwald.
Yes.
Senator Perkins Coahuila.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 8-2 in affirmative.
The vote being 8-2, FIS 22-280 passes. And that's with the understanding that we will see you in November for all things education and SNAP. How's that? Because it will have some impact on the budget.
Sure. Thank you.
Thank you. Okay. We now move to the informational items. And I can't find page 5. Oh, here it is. Okay, all right. No, I found it. Okay. The Representative Leishman had a question on FIS 22-298. This is the
Dashboard.
operating statistics dashboard.
Thank you, Madam Chair. So I apologize for jumping earlier, but we're finally at the right spot. So on the table you provided us, Table 8, it had the annual totals for clients served by community mental health centers. And I see there's been quite a reduction from 2012 to present. I don't know if you could explain why there's been a reduction in service.
So, good afternoon, members of the committee and Madam Chair. I'm Katia Fox. I'm the director of the Division for Behavioral Health. And first and foremost, I want to say that these statistics have been an area that we've wanted to focus on from where we pull the information. And so you'll be seeing when we present an updated dashboard and a new design of the dashboard, we're also going to change the way that we pull these statistics. We want to accurately reflect all of the work that's being done by our community mental health centers. And we believe that the new and improved dashboard will also include new improved data in this particular area. With that being said, I think that what I would like to focus on, I see the big drop that you probably noticed from last month, from June to July. I went back and looked at that, and we also had an even more significant drop last year. And a couple other years as you go through the dashboard. So we can attribute it to several things, probably seasonality, with school ending and the summer providing more opportunity to not be engaged in services as people do different things through the summer months. But also, we know, as you've already heard, about staffing issues. And the centers have been among the many healthcare providers who've struggled with staff. And so you need staff to be able to provide those services.
All right, thanks. Thanks, Madam Chair.
Are there any further questions? Yes, Senator Rosenwald.
Thank you. Two questions, if I could. We've seen a lot of items to put money into more restrictive settings in the mental health system, but not into the community mental health centers to the same extent. And I'm just wondering if you could talk about why we haven't worked to address the staffing issue financially as we have in facilities. That's my first question.
So I'm just looking to see if someone else wants to jump in. But first and foremost, the community mental health system through the 10-year plan has been an amazing effort that has occurred over the last few years. And I know you've been part of that through legislative action to provide significant funding. That funding has all gone to the community system. So we've been talking about housing. We have raised rates through that process, through Medicaid. We've had the 3.1% increase and then a subsequent one. We supported the community mental health centers through the ARPA funding, and before that, the CARES Act funding. That has all gone to support and shore up the community mental health system, and specifically to community-based services. We have housing dollars that we've been putting in there. We have had different initiatives, and be happy to list those out. As a matter of fact, you'll be hearing about this next Friday at Health and Human, with HHS Oversight, because we are submitting our required report and then doing a presentation on that, on all of the efforts. So we have been doing that, and I don't think there's any one sector in the healthcare system right now that has a solution and has been able to crack that nut when it comes to staffing.
Thank you. My second question is probably really for Nathan. We got information that the department had lapsed $35 million in revenues. I think that's the additional 6.2% FMAP.
I would have to dig into the details to specifically answer that question. Upon initial analysis, I didn't identify that. However, I know before I started in my role, I know that Karen had previously spoke to all of you about the revenue challenges that we have in identifying and estimating those on an ongoing basis. I do have an update on that. We did acquire a system. We procured a system this past spring, and we developed it, and it is now currently live. The downside is that we're currently entering data in for this upcoming budget, but we won't be able to really utilize that until we have a full year of complete data, which would not be until the end of state fiscal year 2024, which would allow us the analytical tools to really easily dig into that. I can go back and conduct a more thorough analysis if you'd like, so that I can give you a little bit more insight into what revenue sources feed into that revenue lapse, if you'd like.
That would be great because
Sure.
we've been told in the past it is the additional federal match.
Yep.
But that means that we are not spending the appropriation, and that's why we're lapsing the funds. So my question was, could the department tell us, please, which programs are lapsing appropriation that is losing us federal revenues because we can't find the services or something?
Sure.
Can we find out where?
Yes, I'll go back and conduct that analysis and follow
That
up.
would be great. Thank you. Thank you, Madam Chair.
Senator Rosenwald, since we're going to have education and HHS here in November, is that soon enough or?
I expect to be out of town for that meeting, but
Oh,
yes, whenever you schedule it.
well, then.
But there'll be written materials I can look at.
Yeah, but I would prefer you to be here. So, October, we have DES coming to talk to us about PFAS in landfills. And
That's exciting.
yeah, it is. It's very exciting, especially if you looked at what's going on with our landfills in the state. So I guess they told me it would take them about 15, 20 minutes on the
In October.
yeah, in October. So let's try to do this in October. Is
That
that,
would be amazing. Thank you.
would that be okay, Nathan? Oh, I'm sorry.
I think so.
I should refer to you by your position. I apologize. Okay, so hopefully we can get that together. Are there any further questions? Okay, are the auditors here? Okay. And then we are anxiously awaiting a presentation from DAS on retirement health care.
I have a judicial retirement trustees meeting I need to go to.
Okay, thank you.
My name is Jean Mitchell. I'm the audit supervisor with the LBA Audit Division, and with me is the Adjutant General, Michaelitis. So I'm here today to present the report on our assessment of the internal controls in place over the receipt, deposit, recording, and reporting of revenue, as well as the authorization, payment, recording, and reporting of the Department of Military Affairs and Veteran Services expenditures during the 9 months ended March 31st, 2022. If you turn to the table of contents, you will see the executive summary, summary of results, background, our audit objectives, scope, methodology are located on pages 1 through 5 of the report. The report contains 3 findings and recommendations, none of which suggest legislative action may be required. The department concurred with all of the observations. Moving on to the background section on page 2, the department was legislatively created by Senate Bill 208, which became effective in September of 2019. The bill consolidated military and veteran services, which were previously housed in 3 separate departments, into the Department of Military Affairs and Veteran Services. The department is organized into divisions, including the Division of Veteran Services, the Division of Community-Based Military Programs, and the state's Veterans Cemetery, as well as 2 advisory boards, the Veterans Council and the Military Leadership Team. The department is overseen by the Adjutant General, who essentially functions as the commissioner and is also a member of the National Guard. The department is funded mainly by federal revenue reimbursements. The department spends funds in accordance with the Master Cooperative Agreement, which provides federal support for services provided to state military departments for authorized facilities for leases, real property services, operations, maintenance, repair, and minor construction costs, as well as several military construction cooperative agreements, which provides federal support for the construction of military facilities, real property improvements, and design services. The department records its revenue and expenditures in the general fund and the capital projects fund across 61 different accounting units within the state accounting system. On page 4, you will see a summary of the department's revenues and expenditure activity for the 9 months ended March 31st, 2022, which includes approximately $11 million in total revenues and $22 million in total expenditures. We conducted our audit in accordance with government auditing standards. The objective of the audit was to evaluate whether the state had designed, communicated, implemented, and operated suitable internal controls over the receipt, deposit, recording, and reporting of the department's revenue, as well as the authorization, payment, recording, and reporting of the department's expenditures. As reported in the summary of the results, we found the department's controls over the receipt, deposit, recording of their revenues, as well as the authorization, payment, recording, reporting of their expenditures were generally suitably designed to provide reasonable assurance that the specified internal control objectives were achieved. The observations begin on page 7. In observation number 1, recommend that the department formally document its policies and procedures covering the major areas of its financial operations, and to look for areas to gain efficiencies within its current process for tracking and requesting federal reimbursements of expenditures. Written policies and procedures should be approved by management and be in sufficient detail to prevent significant disruption in its operations upon the departure or absence of key employees. In observation number 2, beginning on page 9, we recommend the department establish and document a formal risk assessment process for recognizing, evaluating, and responding to risk that it could affect the major areas of its financial operations, including the receipt, deposit, and recording of revenue, and the authorization, payment, recording, and reporting of its expenditures. The risk assessment should be periodically reviewed and revised as necessary to ensure it remains relevant, and should be reviewed and formally documented. Finally, observation number 3 on page 10 recommends the department work with the State Department of Administrative Services and the National Guard Bureau to document its arrangement with the New Hampshire National Guard for the federal supervision of state employees in a memorandum of understanding or other formal policy document, which evidences the agreement of both parties. The policy document should clearly outline the roles and responsibilities of each party to ensure the supervision of department employees and approval of employee time cards is completed in accordance with state policy. We also recommend the department's current process for completing a secondary review of employee time cards should be strengthened to include the evidence of the review. Additionally, the department should consider requiring New Hampshire National Guard supervisors who receive access to the state's time management system to complete a confidentiality agreement underscoring that they may have access to personal and confidential information and that they are not to disseminate it. The appendix, beginning on page 13, reports the current status of prior audit findings. The status key on the bottom of page 14 reports that the department has fully resolved 7 observations and 1 remains unresolved. This concludes my presentation, and we would like to thank the Adjutant General, the Deputy Adjutant General, as well as the business office staff for their help and cooperation during the audit process. And if you had any questions, we could certainly answer them.
This is a question dealing with, does the Guard Bureau, the DC Guard Bureau, have people located in your office?
Ma'am, for the record, Major General David Michaelitis, Adjutant General, Department of Military Affairs, Veteran Services. No. You're talking D.C. Guard, like the Washington, D.C. District of Columbia National Guard, or are you talking like?
No, I'm talking about the Bureau, the National Guard Bureau.
Yes, one. We call him the United Property and Fiscal Officer. So he's a Title X individual who's essentially our federal money guy. So his money's dispersed through National Guard Bureau to the state of New Hampshire. It goes through him. So he's sort of our federal money guy. Then he disperses the funds for the state business office.
Well, who is he paid by?
The U.S. Army. Well, he's Air Force, the U.S. Air Force.
So he's paid by the Guard Bureau.
Yes.
Okay. Okay. Because it was confusing to me, this write-up dealing with who could sign time cards, and who could, supervise, because anyhow, normally it's the ranking person, no matter who they are.
Right. So in this particular case, just conceptually, 3,000 strong, about 2,800 service members, about 150 federal Title V civilians, and 150 state employees. Most of the state employees work underneath maintenance, maintaining our facilities throughout the state, both Army and Air. So generally speaking, that maintenance worker, his supervisor, is probably either a federal civilian or a federal military individual. So that individual is the one who signs the time card, because they're the ones who have oversight. So it's just more of the documentation of the risk associated with that time card signing process. Does that help?
Okay. I just want to make sure that we're not creating complications that don't need to be there.
We do it. It's just not a formalized process. So we have no issue with the finding.
Okay. So you'll set up a procedure or something or other for that.
Yes.
Okay.
Yes, ma'am.
All right. Thank you. Are there any other questions? I do have one more. Sorry. I know that risk assessment is a problem across all agencies, not just the whatever you are now, the military affairs. And I'm not exactly sure how we solve this problem, whether it's a reminder to all the commissioners or a new audit that just goes out and looks at do you have risk assessments? Because this comes up all the time. And I recognize that in my past life, I got dinged because I didn't have risk assessments. And I mean, we are dealing with public money, and we should be making sure that we're guarding those dollars accurately, and we're following the procedure. So, and since this was written up in 2007, and it was still open, and now we are in some other year, and I just get concerned that, risk assessment is probably not on the front burner of, and I'm not talking just about military affairs, but I'm talking about the entire scope of the state government. So anyhow, that's just my comment, and I know that Mr. Kane will take that back. So, okay, is there anything else that you would like to say? Either one?
Ma'am, the state was exceptional. We have an internal auditing department on the federal side, so we get audited a ton to make sure the disbursement of federal funds to the state is done in an appropriate manner. It was exceptional working with them, and we have no other comments other than I was talking to Senator Daniels earlier, is just struggling when you hear all these other state departments talk about the challenge for either healthcare workers, snowplow drivers. No one's joining the military this year.
Yes.
In the Army, we're having our worst recruiting year since the end of the draft in 1972, and it's affecting us.
That's true, very true, across not only the Guard and the reserves, but the active duty as well. I read that and it makes me sad. Okay, thank you very much. Appreciate it, and thank you for your work. And now, Mr. Arlinghouse. Oh, wait, I need a motion on the,
Madam Chair, I move to accept, place on file, and release to the public in the usual manner this audit.
Second.
okay, thank you. You got those two people? Yourself and Representative Petrie? Can the clerk call the roll, or do I need to? I can just do a show of hands. Can I just do a show of hands? Okay. Hello. All those in favor? Opposed? All right, the motion passes. Thank you very much. So, by the way, very good piece of paper you put together here.
Thank you. We buy our paper in bulk.
Yeah.
So it is a very good piece of paper, and I didn't do it. Joyce did. I'm Charlie Arlinghouse. I'm the Commissioner of Administrative Services.
I am Joyce Pittman, the Director of Risk and Benefits.
Chair Umberger asked us to do a presentation and to talk to you about how we pay for health insurance for state employees and retirees. And it's very easy for us to get in our heads and think everybody remembers when the state went from from fully insured to self-insured. When Craig Benson was governor, God knows how many of you were in office at the time. And then, although actually probably more of you than not. But a refresher is always good because we live and breathe this every day. And Joyce is going to talk to you about the health. I wish Senator Perkins Quoker were still here because I wanted to say that one of the most important things in recruiting employees in the state, wages are always the first thing, right? We're all crazy if we don't pretend we don't look at the salary. But for the state, one of the ways we're wonderfully competitive is on health benefits. And it's because we do a really good job on health benefits and are able, therefore, to offer good health benefits. And that's largely because of people like Joyce, who's going to talk to you.
Okay. Thank you. Thank you, Madam Chair, for the opportunity to come here and talk about the health benefit plan. I know it's late for this presentation in the morning, or actually early afternoon, so I do want to have it interactive. So if there's something I'm going over too quickly, please stop me if that's okay. But the Division of Risk and Benefits submits an informational item every other month to the Fiscal Committee. And the purpose of this presentation is, just as Charlie said, is to provide some of that background. But before we get too deep into the slides, I'm on slide 3. I thought it would be helpful to talk about the two different types of health benefit plans and the funding mechanisms for those benefit plans that we use them frequently in our world, but not sure if everybody knows what we're referring to. So there are two different funding mechanisms for health benefit plans that we focus on. One of them is fully insured. And basically, with a fully insured plan, you're looking at who's assuming the risk for the cost of the claims. In a fully insured claim, it's usually an insurance carrier who we pay a premium to every a monthly basis per our members per month, and then they assume the claim cost. In exchange for that, they may receive some sort of federal funding. I'll speak in particular to our Medicare Advantage program. Our Medicare Advantage program for our retirees is fully insured, which means Aetna, who's our current carrier, pays those claims, all those healthcare claims that our retiree receives, and in exchange for that, we pay them a premium, which I'm going to talk about in a little bit. And then the other type of plan is a self-funded plan, and that's where the state is on the hook for the cost of those health benefit, those claims expenses. So in exchange for paying for those claims, we are also eligible to receive subsidies. When we're talking about prescription drugs, we talk about rebates regularly. So those rebates come back to the state. If it's Medicare, well, we have a Medicare Part D plan for prescription drugs for our Medicare retirees. We pay for those prescription drugs and we get federal subsidies to do so. And I'll talk more about that to come.
Just a quick question.
Sure.
Are all state employees under the self-funded program?
State employees are, yes.
Okay, so across the board.
Yes.
Okay. And then the retirees are under the fully insured.
Yeah, so on slide 4, you're giving me a great segue to get to the next slide. The retirees are split. So what you'll see at the top from our employer-sponsored group health plans, the active employees and our troopers, they are for their medical benefits through Anthem, that is self-funded, as well as the prescription drugs through Express Scripts, also self-funded. And then all the way to the right, you'll see that we have Northeast Delta Dental, which is also self-funded. And so across the top are all of our active employees and anybody who's eligible to participate on our active employee plan. Then below that, you see the retiree health plan, and that's really split. So our non-Medicare retirees, we often use the phrase commercial. It's our commercial plan with our actives and our non-Medicare retirees. They are self-funded, and they're on an Anthem self-funded plan, as well as Express Scripts as a self-funded plan.
I just want to jump in. Self-funded. They are not self-funded. We are the self, not they are the self. So and I know everybody knows that, but I want to remind you, self-funded means the state's on the hook as opposed to the insurance company's on the hook. It does not mean the person is on the hook. I know. Every now and again.
Yep, no, thank you. So then at the bottom there, you'll see Medicare. And Medicare, we actually have that population in a fully insured, Aetna's on the hook, to use that phrase, to pay those medical claims. That is a Medicare Advantage program, also referred to as a Medicare Part C plan. And then our Medicare Part D prescription drug, D as in dog, plan is self-funded through Express Scripts. The laws establishing our health benefit plan are the laws that manage us. Under 21I30, it says that the state shall pay a premium, partial premium toward group health benefits or self-funded alternative, which we've just discussed, within the limits of the funds appropriated each legislative session. And then more specifically, Section E of 21I30 specifies that we will have an employee and retiree risk management fund. We refer to it as Fund 60, and that is an internal service fund that is non-lapsing and continually appropriated to DAS. And we're using those funds only for the use of the health benefit plan to pay for those claims and administrative fees that are related to administering those plans.
Yeah, yes, Senator Daniels.
Thank you. Before we leave page 4, just a quick question on the non-Medicare self-funded with Anthem. Is that the same plan as the active employees and troopers have?
It's actually, it's very similar. They have a little bit of a different copay structure, but yes, it's the same. They're still using the national preferred formulary that the active employees have.
And on your Medicare, is there a reason why you are using a Medicare C program without drugs versus getting one with and then a standalone program?
The reason now is really a result of contracting. So our prescription drug contract is under a different program, but we always explore what would that look like if we were to pull pharmacy into our Medicare Part C program. So that would be a Medicare Advantage plan with a MAPD, Medicare Advantage plan, prescription drug plan. But at this time, just based on how we've contracted it, we actually implemented Medicare Advantage in 2018 for plan year 1/1 of 19. And then 19 and 20 was through Anthem. And then we transitioned with Aetna for the Medicare Advantage plan for 2020. and we still had Express Scripts separate, but we always explore that as an alternative. So there's no reason that's preventing us from doing it. It's just the way it is right now. If we see that we could attain additional savings, we will do that, but we are still getting federal subsidies under the current, it's called an employer group waiver plan. We refer to the acronym as EGWIP, but I live in the world of acronyms, so I try not to use those too much. But our EGWIP is a prescription drug. It's a Part D plan, so we are getting that subsidy. We're just holding on to it instead of sending it over to our Part C provider.
Okay, and final question, Medicare C plans change every year. Are our contracts with whoever's providing those longer than 1 year?
We are currently in a 3-year contract with Aetna that started in 2020. It goes through 2023. When we negotiated that contract with Aetna, they came back with a 0 premium. So the premium for Aetna to assume the risk for our Medicare eligible retirees to be on that plan is costing the state nothing per month. So we have that rate guarantee through 2023. And then we have to look at our plan experience to see what our options are for anything beyond that.
Okay, thank you.
Do you want to add anything?
Okay, just one other question. So DAS determines the rate and then they identify or they charge the individual agencies for the cost of their people. Okay.
Yes. And so we use the term working rate to determine the total cost of what the healthcare is going to cost on a per member per month basis. We actually do that on a per employee per month. And it's a term like in healthcare, we use belly buttons when you're looking at members, like how many members are in your household. So each house could have multiple people covered under the plan, multiple members. Our plan is based on employee, how many employees per month. So that working rate, it's a all-inclusive charge that we charge out. So for our Medicare retirees, for example, even though the medical portion of that working rate is 0, there is still cost for access to the prescription drug benefit. Remember, that's still self-funded. So the state is still paying the cost of the prescription drug claims, right, in exchange for those federal subsidy dollars and rebates. But also any kind of administrative fees for like the Division of Risk and Benefits. We have salaries included in there. We have a health benefits consultant that we work with, Siegel, that helps us develop those working rates and budget rates every year. There's a cost for them as well, and that's included in that working rate. And you'll see more information about the cost of those working rates in a few slides. Sure. So on slide 6, whoops. Yeah, I don't need that. It's okay. On slide 6, I just thought it would be an interesting question. How much does the state pay for health benefits? Seems like a logical question to ask. Thank you. So the total cost of the employee and retiree health benefit plan in FY23 is approximately $320 million, of which 43% of that is generally funded. And then I break out just the populations just so you can see for FY23. By active and the trooper plan, the retiree health benefit plan cost, and then dental sometimes is forgotten, but that is included in our cost as well. And then our budget for the active employee and trooper plan, the budget is sitting in the class 60s for the agencies. And then the retiree health benefit budget, there are self-funded agencies that budget for their projected retirees, as well as DAS has a retiree health budget included for the state portion. When you look at slide 7.
Wait.
Yep.
Wait. When you say self-funded agencies, what agencies?
Oh, do you know which agency?
So, yes,
We'll start
there's
with
the why are they, so they're bringing, so why are they self-funded?
They're non-generally funded
Yeah.
agencies that we bill for the retiree health. They're non-generally funded agencies that we bill for the retiree health costs. It's carried in their budget in Class 64. That money is then transferred into risk and benefits in our budget, and you'll see that if you were in Division 1, you would see that in the retiree health line. The generally funded agencies or population is budgeted as a lump sum general fund. So the retiree health budget in which shows up in House Bill 1 in the DAS budget, you'll see half of it is transfers from agencies via Class 64, and half of it is not quite is general funds, and that's a lump sum general fund appropriation in that portion of our budget. Those of you who have been on group Division 1 in the past will know that I start my presentation with a tale of two budgets. We have two budgets. One is our divisional operating budget, and the other is the retiree health budget, which is a lot of money.
Just some examples of agencies that are self-funded. So we have liquor, transportation, safety, fish and game, banking is in there. Insurance is in there. Yeah. If you'd like, I can give you a list.
That's fine. I just trying to, when you say self-funded, I'm going, I don't know of any agency that doesn't get something from the general fund. Maybe lottery and liquor.
It's a function of of their employees and the when this is a de minimis thing 20 or 30 years ago, and it wasn't ever de minimis, but it didn't matter. But at some point, the history of state budgeting, if you look for probably forever, but certainly for 20 or 30 years, is a question of how do we make sure that we're capturing costs and the general fund. And if you think of things like SWICAP, for example, it's a way to get the non-general fund portions of the operations, so to speak, to pay their share of that function, as opposed to it all being just like, oh, just stick that in a general fund. And so with retirees, it's like, well, you retired from liquor, therefore you're this. You retired from admin services. In one of our general funding pieces, you're this. And so we sort that out.
On slide 7, you'll see some history of the total health benefit costs over the past 10 years. It's kind of a logical slide to look at, where you can see that costs are going up over the years. You can see a little bit of a blip between FY19 and FY20. I'd like to say it's 100% because we went to Medicare Advantage and saved all kinds of money, but there was something else that happened in calendar year 2020 that definitely impacted the cost of healthcare. So we did see a decline in healthcare expenditures during the COVID times, but you'll also see quickly after that we've rebounded. So we're back to pre-pandemic, I'll say, utilization. On slide 8, we have an internal Fund 60 management team that meets we meet bi-monthly, but we report to you monthly on what our fund balances are. And we use that as a management tool for looking at fund balances, looking at where we're going for our budget. These are our working budget rates. We also have reported to Fiscal in the not too distant history about doing premium holidays for certain populations, and it's how we're managing our reserves, just to make sure that we're giving that money back if the reserves are getting higher than thresholds that we've determined. Like basically COVID was slowing down cost expenditures, so we don't want to allow those reserves to get too high.
Thank you, Madam Chair. And as one of taking advantage of the retiree plan, I'd like to thank you for the holiday we had this summer for premiums.
You're welcome.
There you go.
So you know about holidays. Excellent. We give the money back to where we got it.
It's a notion, it's something worth noting, right, is that we're collecting premiums, we're collecting benefit charges from agencies into an internal service fund, we're collecting money from retirees. And we have a statutory responsibility and a moral responsibility, obviously, but to not collect more than you're supposed to. And if you collect more than you're supposed to, you collected it as a health charge. You can't then go out and spend it on a Christmas tree or something like that. And that's one of the reasons for the holidays is for that reason, that this is money. We had this discussion when Senator D'Alessandro usually would ask about it. But we can't legitimately and legally, I think, use that money for any other purpose. Like there would be no point where we looked at it and went, we need to repave why don't we just use that because we got extra. We collected it as the equivalent of a healthcare premium. It must be used for that, and it's part of the reason that there's a management team on the Internal Service Fund, and it's part of the reason that Fiscal has historically wanted us reporting to them every 2 months, is to say, yeah, what'd you collect? Did you use it? What are you doing about that? And it's that, I don't want to say they're skeptical, but it's basically, keep us informed about what's going on, because Representative Emmerich needs his money back.
Do you know, what do you normally keep as I'll call it a reserve for self-funding? Because obviously, the state is paying for that and you don't want to run out of money there, but if you get extra in, what's your buffer?
This is one of my favorite things. I'm sort of obsessed about it. There are two kinds of reserve: a statutory reserve and a cash balance reserve. But they're both reserves. The one is specified in statute as a percentage. It's a slightly different percentage for retirees, for the separate trooper group, and for actives. But it's 3% or 5% for either one. Actually, I think for troopers it's 100%.
In law, it's 3, minimum of 3. It's what we've chosen as.
And then we've chosen to set that because troopers are a very small group that are very volatile, partly because they're small. Actives are a very large group who have less volatility. One of the things we discuss often at the internal governance meetings is how big should the reserve be. We have targets which are currently set as a shorthand at 2 to 3 months of revenue. 2 to 3 months of expenditure. How much do you want to have in reserve? A couple to 3 months of expenditure. One of the things that I look at in particular routinely is what's your high month, what's your low month, because months aren't equal. I mean, generally we spend on a weekly basis rather than a monthly basis in terms of billing and administration. So there's a 4-week month and a 5-week month. But the delta between the highest month over the last 2 years and the lowest month over the last 2 years, the ratio between them is more than 100%. That is, something like 250,000, 612,000. And so what we want to guard against is we want to look at two things: trend. And trend isn't just did this month go up or down, because there are all kinds of reasons for that. But the other thing is, are we getting to the point where the reserves are ticking down, 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 down? And so we need to look at what's going on and be careful, or up, 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 in which case we need to plan a holiday. Reserves get too high, we have a holiday. Reserves get too low, we don't have holidays, and we have to start thinking about things. The last time we had a serious cash flow threat, maybe it was 2015. And Fiscal in those years took action on things like, on the retiree side in particular, on things like premium prescription drug payments. And there was a lot of discussion about what we might do. And then in the 2017 passed budget, there was a change to the retiree health eligibility.
So along those same lines, on slide 9, we hold a term or a expression that former Commissioner of DAS Linda Hodgson said. How do you know how much? The question was, how do you know how much money you need to pay for your health benefits? And she said it's basically like landing a 747 on the head of a pin. And it's a result of all the different variables that influence healthcare expenditures. And the next slide, on slide 10, just goes over a few of those. There are more than this, but one of the key variables that we look at is enrollment. Enrollment going up. Is it also the cost trends around that. What are people spending their money on? You can't predict who's going to get what diagnoses and who's going to need what for care, but you try to look at that over what you've been trending, as well as claim mix, inflation, innovation. There are drugs out there now that cost a lot of money, but they're saving lives. So we want that to be available for our members. We rely on our third-party administrators to help us manage those costs. But there is that potential for those types of expenses coming to the plan. In addition to, as you all know, the funding, the sources of those funds in the budget, and also plan design, looking at how our members are utilizing the plan. What are they paying for, that cost share? There is some change when you increase deductibles, people start to weigh in, that consumerism is introduced. And that's with everybody. And then at the bottom of page 10, on the right, there's that bullet that says different incentives, getting our members engaged in shopping for healthcare and looking for, they're all high quality healthcare, but the price variation amongst providers can be significant. So can we incent their behavior to shop, give them a little incentive, and save the plan some money? And that is something that we can do for only our active and our non-Medicare members on the plan.
So we do provide some incentive, or we don't?
We do for our active employees. There's a program called Smart Shopper. And if they shop first before they seek services and they actually go to one of those high quality, lower cost providers, they can receive a cashback incentive for doing that. And the same for our non-Medicare. Medicare does not allow any kind of steerage.
Right.
And that's
Right.
considered steerage. So we're not permitted to do something like that for our Medicare population.
Okay, thank you.
So on slide 11, the members enrolled in our health benefit plan, if you're talking about belly buttons, as I mentioned earlier, we're looking at about 37,500 members on our health benefit plan. And it's broken out by the actives. We have about 23,000, troopers 850. And then our retiree plan is split like we've been talking about. So about 13,500, 2,500 non-Medicare, and about 11,000 Medicare retirees. The big difference between our active plan and our troopers plan is their plan design and everything about their health benefits is collectively bargained. On the retiree plan side, their benefits are determined by the legislature. And so that's a big difference between those two different programs.
Are the other state employees, is that part of the collective bargaining, or do you just?
The state employees?
Yeah,
So the state employees, are you talking about all state employees?
I'm talking about the 2,300 members.
So the 2,300, that's
mean
the members. There are about
23,000.
9,300 state employees. And yes, they're all somehow connected to the collectively bargained plan design.
Oh, okay, I
that's
can't
available.
read, okay.
It's okay. It's a lot of information to throw at you. On slide 12, I just did a deeper dive on retiree enrollment, mainly because, as Charlie just said, we've made changes over the past few years to how our retiree health benefits are designed to work on cost containment strategies. But one thing we can't prevent is people getting older. So that is happening. And what you'll see on slide 12, no. So the top line that you can see going up, that's our Medicare population. And you can see from 2013 to 2000 or projected 2025 population, we're over 11,000 members there. And then the bottom line is the non-Medicare population. And so one reason why that population is declining is because they're getting older and they're moving on to the Medicare plan. And the other reason is that we made some changes to our eligibility for the people who are eligible to retire before age 65, before they're Medicare eligible. So that's also part of it. The other part of it is people are working longer. So they're not retiring before they're Medicare eligible. They're actually in the workforce longer. So there's a few competing demands that's pushing that Medicare enrollment faster than, and you'll see that decline on the non-Medicare.
So I pay money every month for my Medicare.
Mhm.
Where does that go? For the Medicaid retiree, Medicare.
Are
Are you a state retiree?
No. I
So,
want to,
so you're probably, are you thinking about your Medicare Part B premium that you're paying that's coming out?
Yeah.
So that's going through, actually, I think it's coming out of your Social Security check. So the federal government is taking that. That's not coming to us. We're not getting, what you're paying out of your Social Security check is not coming.
no,
to
but I'm talking about the retirees, the Medicare retirees.
So our Medicare retirees are also paying a Medicare Part B premium, and it's the same thing. So we're not collecting.
Okay, so that goes to the federal government.
Yes, it does.
And then that must be part of the federal reimbursement.
Yeah. Yeah. So that can be confusing. So I'll try to say that slowly. So our Medicare eligible retirees are paying, they're paying two things. They're paying a Medicare Part B premium that's coming out of their Social Security check, and that's going that way. And they're also paying a premium that's coming to us that gives them access to our group health benefits. And you'll actually see that in a few slides of what they're paying, but it's roughly about $20 per member per month that they're paying that's coming to us. In exchange for that $20, the cost of healthcare, so our Medicare retirees are responsible to pay a Medicare Part B deductible. And that's, this year it's like $203. So once they've met that out of pocket, they're getting their coverage through the Medicare Part C program. Let's leave pharmacy aside for a moment. They're getting their medical benefits through the Aetna plan. Aetna then is the one who's submitting the bill to the federal government. That's it. So our retirees go to the doctor. They give their Medicare Advantage Aetna card to their doctor. And the doctor in exchange invoices or bills Aetna, and then Aetna handles, okay, this is a Part A or Part B. You know, A is your hospital-based charges or your inpatient charges, and Part B is your outpatient type of services. Aetna handles all of that. So in this world, Medicare Part A plus Medicare Part B equals Medicare Part C, if that makes sense. And Aetna takes care of that for our members. On the Medicare Part D, as you know, as in drug, our members use their Express Scripts ID card when they go to the pharmacy, and then Express Scripts turns around and they actually invoice us for the cost of that drug, and we pay for that. But in exchange, our retirees pay a copay, and that depends on whether or not it's a generic, a preferred, or non-preferred. I included some more of that information if you really want to dig deeper in the appendix. I just didn't want to get that granular because I know it can get really weedy, but there is an appendix that gets a little bit into like what's the copay structure and whatnot. Did that answer your question? Okay, perfect. On slide 13, just more about how we're trying to maximize our federal funding. So in 2015, we moved to that employer group waiver program that I was referring to as an EGWP plan for our prescription drug. Prior to that, we had a program called RDS, which stands for Retiree Drug Subsidy. So the state was still receiving subsidies from the federal government, but through working with Siegel, we were able to determine that we could increase our federal subsidy by moving to that employer group waiver program through Express Scripts. So we made that change in 2015 and have increased that revenue source to our plan. In 2019, I know I already covered this, just to recap really quick, we actually did an amendment to our Anthem medical TPA contract to carve out our Medicare population and put them into the fully insured Anthem program in 2019. And the premium that they were paying just for that Anthem program was about $109.11 per month. I say about, and I am giving you down to the penny. It's burned in my brain. And then that was the same for 2020, but then we went out to bid. Procurement, as you know, is a strategy to look for cost-saving strategies and cost containment strategies. In 2021, that's when we were able to lock down that $0 per member per month premium for Aetna's access to the Aetna program. And that, like I said, is a 3-year contract, and we're estimating about $15 million in savings per year for 2020, 21, and 22.
Also, we're looking at
We,
improved.
we have a
Sure.
question.
I thought I just heard you say that the retirees were paying $20 a month.
So remember, so the retiree, that's the working rate, and I'll show you that too, so you'll see those numbers break out, but that's the total cost of their premium, which includes pharmacy.
Okay, so actually what they're doing is the zero per person per month you're talking about is actually no deductible on health care, or no premium on health care, but $20. But, okay, but the other one is self-funded.
So the $20 that they're paying so it's like $200 a month is what the state pays to provide our retirees the access to those group health benefits. So the Aetna, the Express Scripts, and then that extra administrative cost for consulting and DAS salary, risk and benefit salaries and that sort of thing. That's less than, is that less than 3%? That's a small amount. So you'll see that coming up on a slide so you can see the breakdown. So we calculate that 10%, which is in law. So if you're a Medicare retiree and your date of birth is on or after 1/1 of 1949, you pay a 10% premium, and that's 10% of the working rate, which is roughly $200. So that's where they're paying the 20.
Okay.
And you'll see that again in a little bit. Just the other thing, like I said before, is we look at procurement as a mechanism to find more ways of saving money for the state. We have a contract with Anthem through 2022, and we just renewed with Express Scripts, and we're able to attain about a 5% savings for the state just by doing that procurement.
May I ask?
Yes,
May I
please.
ask what when you said the cost to the state, I think you said for the Aetna was like $200 a month, and that's where the 20% that the employee pays. Is that, did I understand that correctly? I mean, roughly that's correct.
So let's skip to slide 16, because I think if you can see the numbers, it helps.
Okay,
A
sure.
little bit. So over the years, it should say at the top, Medicare monthly premium contribution history.
Yeah.
And if you look at the bottom there, as of 1/1 of 2022, you see $204.87. That's what we call our total working rate. That's what per member, so each retiree on Medicare and or their spouse, because the spouses can be on Medicare, that's what it costs us per member to be on our plan.
For both Aetna and Express Scripts.
For the total working rate includes both Aetna, which remember is zero, and Express Scripts, which is roughly about $20 or $204, excuse me, which also includes the DAS administrative small margin to add to that.
Right. And no, I guess I understand that. I guess my question, just to make sure I'm understanding. So that strikes me as a really, the 204.87 strikes me as a really small amount of money, which leads me to believe that most of how Aetna is being compensated for being the insurer is they're getting paid by the feds from our Medicare premiums, which are a lot more than $20 a month.
So they're also getting paid by the feds. So when you look at a Medicare Advantage program, they're getting paid by the federal government to keep that care at a certain level. So they're managing their care, and then they get what is referred to as they get a risk score. So if they're managing their population, they get a rate by how sick their population is, and it increases the amount of money the federal government pays them. But they also, if they can keep those people healthier, they keep that money. So by them inheriting our population, that roughly, what did I say, like 11,000 people, and they can manage that in their bigger book of business, because Aetna's big. So it's not just us. But they also got a lion's share of a large population in the state of New Hampshire. So if you're coming into a market and you want to start taking over a business in New Hampshire as a Medicare Advantage program, if you can take on the state as your client, it's worth the zero premium that they're charging us. So we're leveraging that to our benefit.
Yeah, but the big picture, they get money from the state, only in this case they don't, and they get money from the feds. And they got to cover their costs with those. And Aetna just said, yeah, we can make enough off the feds, so we're good. And by the way, they probably thought that at zero, they would win the bid, and they were right.
So basically, this is the cost of the supplemental insurance for retirees on Medicare.
I don't like to use that word because that's a different thing.
I know, but in a dumb person's conceptualization, there's a gap between what Medicare pays and what I have to pay. And this is basically covering that.
This is basically paying for your, I'll say it this way, your prescription drug benefit. I feel better if you walk away with that than saying it's paying for a supplemental plan, because there is something called a Medicare supplemental plan, and we no longer have that. We used to, but we don't have that anymore.
Fine, I don't want to get hung up on the words.
I know Senator Daniels knows exactly what I mean.
Can I clarify that with a Medicare Advantage plan, Medicare does not pay any of the claims. They give a subsidy to private company like Aetna, Humana, Anthem, places like that. So your insurance is through a private company, which, as she pointed out, is different than a supplement, which Medicare pays, say, 80% of it, and then a supplement picks up the other 20%. So it's a whole new structure, but you do have to pay that Part B premium of $233 in order to be eligible to get a Medicare Advantage plan.
Thank you. He does this for a living.
I know. That's why I was looking to him. So I'm just going to go back. We just quickly glazed over. I think we're done. This slide 13 at the bottom there just says we made some changes to plan design. And then slide 14, I'm often asked this of like, what did we do on the eligibility side of how do you get into retiree health benefits? And you can see it's on slide 14, it's divided by group 1 and group 2. And then you can see the changes that were made. So prior to July 1st of 2003, there was a different benefit, but as of that date, we required 10 years of service and a minimum age of 60, unless you had over 30 years of service. And then you can see the next change that was made, and these changes are being made in law, on or after July 1 of 2003, but before July 1 of 11, the service requirement increased to 20 years. I'm looking at the group 1 box on the top, and it's still the same minimum age requirement. And then as you can see on or after July 1 of 2011, it's still 20 years, but we changed the entry point to being age 65. And that's where you're seeing that decline on the non-Medicare side because people are on that eligibility for Medicare side of the coin. And it's similar to group 2. I won't read that unless you would like me to go over group 2. And then on slide 15, you can see the changes that we've made in the non-Medicare premium over the years. So starting in July of 2009, that's when our retirees started paying a premium. It was a flat $65 per month fee to be on our non-Medicare retiree health plan. And then as the years went on, you can see in January of 2016, we actually, Fiscal Committee actually increased the premium contribution from 12.5 to 17.5. And then after that, in October of 2017, I want to say, Charlie, that was the trailer bill, the big Christmas tree bill. Included in that bill was the increase from 17.5% to 20%. And that's where we still are today for our non-Medicare retirees. I know we covered slide 16, but you can see, so as of January 1 of 2018, this was actually included in that same bill that increased us to 20% for the non-Medicare. For Medicare, you have to make changes on a calendar year basis if it's I'm going to call it a negative change or a change that costs the retirees more on Medicare. So we had to postpone that change to January 1 of 2018. So if you were a retiree and or your spouse with a date of birth on or after 1/1 of 1949, that's when we started having a charge to our retirees on Medicare of 10%. And you can see through cost containment efforts that in 18 it started at $36.24 per month. And then you can see we were able to decrease that in 19. That's when we went, remember, to Medicare Advantage. We kept it flat in 20. In 21, it decreased again. That's a result of the changeover with the zero premium going to Aetna in 2021. So our retirees paid almost $10 less per month at that point. And then here we are in January of 2022. It went down a little bit more.
I just have to add, because this is insane. I'm going to just point this out. This is ridiculous in terms of what happened. It's literally not possible. I'd have told you. Costs are not going to go down from 362. Our goal is to make them go up slowly from 362. And they went down to 204. And if you had showed me this after the fact, and I hadn't lived through it, I would tell you that somebody made a arithmetic error and was adding it up wrong. And that a lot of this is Joyce. And just to be honest, Joyce and Cassie Keene, who most of the committee knows, and a lot of work over a lot of time. But our goal is to hit singles. It's what we try to do every day. And they hit like 4 grand slams in a row, and that's not going to keep happening because we're running out of there are only so many rabbits you can fit in a hat, and she's pulled them all out, I think. But it's worth noting that our trend looks like remarkable, where healthcare in the rest of the country is going up 10% a year, and we've gone down and we've cut it almost in half, and we're done. But it's something that I highlight the slide because I'm really, really, really proud of it. It's not me, it's her and her team, but I'm really proud of it. And it's something that nobody in this committee, name me the last program you had where somebody came in and went, you know what, I think we can give you a better benefit next year for half the price. And that doesn't happen, and it's not supposed to happen. And it did. So anyway, that's me giving her a pat on the back.
Thank you. On the last slide almost last slide, slide 17, this was a question that I was regularly asked to report back to fiscal on, just because we're charging a Medicare population and it's only that date of birth, the line in the sand that we had to draw. And the theory behind that, and we worked closely with the legislature to come up with that date. It was not a randomly grabbed out of the hat kind of date, to keep with the rabbit analogy. But it was very, how much could we get away with, or so how can we charge the least amount of people possible? But in time, you can see from fiscal 18 to our projections for FY 25, you can see that our Medicare retirees are projected to continue to increase, but you can also see just through time alone that the people not paying is decreasing and the people paying is increasing. So without moving the date of birth, just over time, it's more people are paying. That's what that is meant to illustrate.
I used to always call this the Ober chart, but I won't explain why.
And then this is the last slide before the appendix, is just what we keep doing. And we're going to keep doing what we've been doing. So we're going to keep managing our vendors. We're going to keep looking for cost containment strategies. We're going to keep going out to bid. We're going to keep looking for more competitive pricing, more creative funding arrangements, trying to get increased federal subsidies where it's possible. We are going to keep exploring what does it mean with our prescription drug? When do you flip it? Like, those are things we ask every year, and we try to develop future strategies to do that. We also work with our retirees and our active employees on how they're managing their individual health, because if we can curb that utilization and keep those preventive visits on the rise, get those diagnoses if needed earlier, manage their health care, manage the diabetes, that's saving us money. And then, of course, plan design, those sorts of things, looking at ways to incent cost-effective health care. So we're going to keep doing that and analyzing the data, and hopefully, as Charlie says, there may be a small rabbit in there somewhere. I just don't know. I'm not promising anything.
There's actually a little bunny in there.
Maybe. I hope there is.
Yes, you may.
It's interesting that the Medicare system's working against you because they require certain levels of care. You have to have every 6 months, my wife's a diabetic, So she has to go see an endocrinologist every 6 months. And if she doesn't, the prescriptions can't get filled. So you're going to be able to compress this to a point, but at some point Medicare is pushing back on you with this every 6-month visit to all of your attending physicians. So, but good for you. I mean, I'm loving it. But
Thank you.
thank you.
Yeah, this was actually a very good presentation, and I'm sorry that our fiscal meeting ran so long, because I do feel that there probably isn't a very good understanding of what goes into that glob figure that everybody complains about and says, well, DAS sets it and it's all their fault, you know. But it's not all their fault. It's all of this. And so I thank you very much. And
We always like the chance to, I mean, I understand that so much of what we do and we, you know, some of the back office and the details and all the boring stuff, as I once said, is something that people don't understand. And I think anytime we have a chance to explain it to people, we're always happy to do so. And I will note for the record that Senator D'Alessandro, who couldn't be here, must not have watched it on film, because he called me 10 minutes ago and he apparently didn't notice that I was testifying before you, and so couldn't take his call.
well, Michael, maybe we can when the budget stuff starts as part of, you know, getting ready for what we're going to be doing in the budget, maybe you can add this briefing to that long list of stuff that we look at to give at least House Finance a better understanding of these costs. Okay, just yes.
May I just make a comment? I just want to thank both of you and the people on your staff. I can't tell you how many times I've called retiree help because I had questions when I retired, and you know, and there was always there was always somebody that answered, or if they didn't answer, there was a message that said, we'll call you back within 24 hours, and they always did. They always had the answers. They were very, very helpful, and so kudos to all of the people on your staff.
That's why I always laugh when Charlie says it's all Joyce. It's not me. There's a bunch of people back in risk and benefits that are phenomenal.
They
They're
do
fantastic.
a really outstanding job. Always had the answers, and it was always right. So thank you very much.
You're welcome. Thank you.
Oh, one more question.
Yes. Is ServiceLink part of DAS, or is that a different agency?
HHS.
HHS, thank you.
Yeah, maybe we should move it from HHS to. Oh, I didn't say that.
I think we're good.
Yeah. Oh, okay. You think you have enough things on your on the table, huh? Okay. Well, thank you all very much, and thank you to those that stayed. And we'll adjourn at 1:30.